It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there's a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but soon they will realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day, everyone wanna hear from Sandra. 'Cause every day, everyone got to hear from Sandra. 'Cause every day, everyone got to hear from Sandra.
All right, folks. Good morning, and happy Tuesday. How is everybody doing? Good morning, Evelyn. Good morning, Marshall. Looks like you're locked into your YouTube instead of Facebook this morning. Good to see you. No, I take it back. Looks like you were on both. Happy morning to Barbara. We got quite a few others here. Instagram is up and live, of course. Hopefully you guys have been tuning in to CMR TV and catching our shows that we have had. There's still some that are in the process of rolling out. So we have Kitchen Talks with Miss Julie Hunter. That would normally be on Tuesday evenings, but she's not quite done recording yet because, obviously she is also traveling with the government at the moment. They're overseas. A number of them are overseas on official business. So we'll bring you guys up to speed on some of that as well. Suyapa, good morning to you. Good morning to Strong Wilt. So good to see all of you here. Well, today is Tuesday. And so every single Tuesday we get educated. We have a nice educational segment. Although I must tell you, we get educated on health, all that Health City has to offer. And they're always encouraging us to do our part to modify our health issues where we can. I mean, we can't always do something about it. It certainly depends on what it is. But I like the fact that they put it in your hands first, modify your lifestyle, eat better, cut out the drinking and the smoking and the whatever else you guys are into that might be a little bit too much fun, to just improve the outcome qualities for yourself. So that's always good. Mr. Olson Rankin is in the house. Good morning, sir. How are you? Strong Wilt, thank you. And we've got Miss Bonnie, who's joining us from East End, said that she is listening and she wants everybody to have a beautiful day, and Wee Wee's here with us. And of course, we look forward to hearing from Shamari every single Tuesday to see exactly what he has been up to especially when it's football season. But I know he's going to tell me he's probably been watching some basketball this week on the local front. Let's check in. Good morning, Shamari.
Hello, Sandy. How are you doing?
Not too bad. How are you?
I am amazing.
Ah,
I'm absolutely amazing because the post Greer era, we are still undefeated. I can't tell you we won this weekend, but we didn't lose. So it was actually our bye weekend, so we didn't play.
Oh. You had me confused for a split second there. I was like,
yeah. Our bye, every team gets a bye weekend, one weekend off during the season, and this was our weekend off. So we actually didn't play, so that's a little joke, but definitely, this coming week we're back in action. So hopefully next Tuesday I'll have a smile on my face again. And as you were mentioning that you have, the Cayman Classic basketball.
Yes.
Exciting, always have some great teams from college. So in US, college teams are like semi-pro teams, right? It's $1 billion industry, and now players are actually through the nil deals being able to be paid, whereas many years previously they weren't. So they're semi-professionals, so it's going to be great action as always, and just kudos to the organizers who are actually able to pull it off. I remember when it was in its germination phase and they were thinking about the idea, there were a lot of naysayers, right? Because they have like Hawaiian Classic, and I think there's one in the Bahamas and such, and they're like, how could they put on another one in the Cayman Islands, and would it be successful? You don't have enough hotel rooms and all of that, but they've built it from strength to strength, and we have some great teams coming down. Not only men, I'm also excited because the female teams they bring, are actually some of the best teams that you can see. And there was even last year, if I recall, or a year before, my years are running together. One of the national championship teams were actually here. Recent national championship teams were here from a women perspective as well. But so go out.
A little birdie told me that I think it's Shaq's daughter is going to be playing this time. So I'm like, wow.
Yeah. And also on the basketball front, since you brought it up, I'm very excited because my Lakers are once again looking like they're going to do things and possibly going to make it to the championship round. It's early days, but the team is looking very, very good. And we have the old man, LeBron James, with us, and he's no longer the number one or number two option. So he's taking a little bit of a back seat, and we have the other players stepping up. So football might not be going so well with the Dolphins, but basketball is going well. Here in Cayman, as well as my team, the Lakers, are doing very well. So you might be talking more about them in the new year as well.
Yeah, very beautiful. Well, I've got some footage after the medical rundown segment today of the Cayman Classics, so make sure you stay tuned for that. Dean is out in the field getting me some interviews and talking to people and all the great stuff. So yeah, we're gonna bring it to you. Fantastic. So today we are. Yes, I know. I know sometimes these doctors must be like, what is with these two?
Hey, that's okay. We have to have our first 5 minutes wrap up and then we get into it.
Exactly.
But yeah, so
exactly.
Today is it's November.
Still November.
And all November and November. And as I'm sure you've gotten to notice, Sandy, there is a day for every disease profile. You have a week, a month.
Can I just tell you something? Yes. I actually have a calendar.
And the calendar has like 2 or 3 things on one day and 1 week. But go ahead. Yes.
Oh my God. It is actually an awareness calendar. And so on that, I have all of the different ones from the US, the UK, like all over. And so Movember has a lot going on. So for example, today is the 25th. It is actually the 16 days of action against domestic violence on the international front. So there's that. It's the White Ribbon Day as well. It is the International Day for the Elimination of Violence Against Women. So we said that already, but there's also 16 days. It is the National Parfait Day. So some of these are kind of interesting to know.
National Parfait Day. Okay. All right.
Yeah. It is Bosnia and Herzegovina Statehood Day. National Natural Fibers Day, in case you have some unnatural fiber. That's in the US. It's also National Jukebox Day. I mean, the list just goes on.
Well, I have a medical calendar, which is all medical. I'll share that one with you.
Yes.
And it's, and they have different observations in the UK, US, Canada. They differ, but for the most part, they're aligned with the big ones, but every day there's something else.
Oh,
but
yeah. I love it though.
This November is Epilepsy Awareness Month. We have our very own Dr. Susant who will be joining us. The theme is All In. That encourages communities, healthcare partners, and families to come together in support of those living with epilepsy. So we're going to be discussing epilepsy today, committing to awareness, understanding, and meaningful action.
Yeah.
And it is my pleasure to introduce Dr. Susant, who's our consultant neurologist. So he's part of that great team of neurologists that we have at Health City. He has over a decade of experience specifically as a senior neurologist. He's been an integral part of robust clinical and academic programs, specializing with multiple publications, specialties such as clinics in stroke, movement disorders, epilepsy, which we'll be discussing today, as well as MS. So that is
fantastic.
That we are so happy to have. And Sandy, we always bring the best of the best to be a part of the team. And we are so grateful to have Dr. Susant to be part of the team and here to actually discuss epilepsy with us today, seeing as it's Epilepsy Awareness Month.
Yes, good morning, Dr. Susant. How are you?
Good morning, everyone. Thank you, Mr. Shomari, for such a detailed introduction. Good morning, Miss Sandra.
How are you doing?
Good. It's the cold, hard truth, and it's cold, breezy days these days.
Oh, I love it. This is the time of year that I am most into the weather. I absolutely love the noticeable change in weather. So, yes, now you can put on a jacket and feel good about it. You're not sweating in your jacket at the moment. We see Ms. Barbara G checking in. She says, my husband and I did go for the lung cancer screening and we're expecting a call back this morning. So fingers crossed, saying a prayer for you, Miss Barbara, that everything is going to be okay. And, please keep us posted. But I'm sure you're going to be perfectly fine, both you and your husband. So good news. And if not, early detection really is the key. So wonderful. All right, Dr. Susant, today we're going to be talking about epilepsy. And this is one of those things that, a lot of people may not totally know much about. I'm sure we've all heard of it, but we're going to get into some of the details of exactly what epilepsy is, since November, as Shamari just said, is Epilepsy Awareness Month. Dedicated to education, advocacy, and reducing the stigma that surrounds epilepsy. So the theme for this year in the US is All In. So what does it mean when we say we're all in when it comes to epilepsy?
So like neurological diseases, they can be dramatic in their presentation. And having a knowledge of what's going on keeps the patient and the family around them have a better understanding of what's going on and try to address the problem rather than cause panic. So the program aims at educating all the community members, the health caregivers, to kind of understand what's a seizure and what the basic steps to do when somebody is having the seizure in the surrounding and how to take care of it rather than just like having a panic attack when this happens, because it's really something physical and right on your face, and it can really be very disturbing.
Yeah. So, wow. I've never really seen it myself, but I'm sure it's got to be something that can definitely take you off guard, especially if you're not expecting it. So the All In really encourages community her healthcare providers and families to all come together in full support of those who are living with epilepsy, committing to awareness, understanding, and meaningful action. For Health City, this month is going to really just offer an opportunity to highlight what the early recognition signs really of epilepsy and seizure symptoms are. Now, is there a difference between like having epilepsy and seizure? Is it a type of seizure? Like, how do you classify? Are they used interchangeably?
Seizure is like when we have a seizure, it can be a provoked event, but when you have a tendency to have continuous seizure, that's when you would label it as epilepsy. They are basically a spectrum of the same condition. So it's a one-off event, then it's what we refer to as a seizure. But when you have a tendency to have seizures again and again, that's when we label it as epilepsy.
Okay.
So seizures can be provoked by a lot of different factors. And yeah, so they're basically, like I said, a spectrum.
Right. Okay. So the epilepsy is more like the condition, whereas you can have a one-off seizure caused by different things. Okay. All right. That's good to know. I didn't even know really how to classify that, but very good. So we need to know exactly what it is, and we're going to find out how to have compassionate discussions around this by reducing the stigma, and also what some of the treatment options are. So what exactly is epilepsy?
So epilepsy is basically can say that's like an electrical storm in the brain. So in the brain, as you know, everything as the conduction is in like electrical conduction. So when you're having an epilepsy, there's an abnormal burst in the electrical activity leading to loss of body functions. So when this happens, this manifests as a seizures, and the seizures have different manifestations, but the most common one is referred to as a general tonic-clonic one. And it affects, for seizures, like we said, can affect about 9% of the general population, while epilepsy affects about 3% of the general population. And it's the fourth most common neurological condition that affects people. When there is a burst in electrical activity or electrical storm, you may see sudden jerky movement in the body followed by loss of consciousness. When you have a seizure which is recurrent in nature, that's when we label it as epilepsy.
Wow. So the fourth most common neurological disorder in the world, who would have known? That's news to me. So if you have two unprovoked seizures, then it is defined then as epilepsy. And then you have a high risk of having even more. So there's actually different types. So let's talk about, what these are.
Yeah. So before we go to the different types, we have to first understand what's a provoked seizure and what is an unprovoked seizure.
Okay.
So provoked seizure, and when you have a medical condition in which the seizure has, like when you have a trauma, when you have a fever, when you have metabolic disturbance like low sodium or more in calcium, the body can throw a seizure, but that is a response to the abnormality in the body. But the brain per se doesn't have any like electrical abnormality, or there's nothing wrong in the brain. So, but while a primary seizure, when there is something wrong primarily in the brain, so you're having a seizure because either the wiring inside the brain is kind of wrong, or there's a structure inside the brain which is causing the seizure. Now, they may manifest as focal seizures when you have a twitching or a movement on a particular part of the body, but usually they maintain their consciousness. They are conscious, but they still kind of have an abnormal twitching in the arms or the face. There's a generalized epilepsy in which both the arms or the limbs will have sudden jerky movements followed by loss of consciousness. And they maybe have a combination of focal and general, where the seizure will begin as a focal epilepsy. The patient is aware for the first few minutes, and then it goes to the other hand, and that's when you lose consciousness. So basically, when both the half of the brains, the hemispheres, are involved, you have a generalized seizure where you lose your consciousness.
I see. Wow. I must admit that this is one topic that I really don't know a lot about, Shamari. So I'm really learning here today. So this is so interesting. Now, you talked about the fact that there are some that are brought on by a particular thing. So it can be, as you say, provoked. So it can be, an imbalance in something in the body. I have heard of people who might have, say, for example, you had a parasite in the brain. That is something that could bring on, a episodal, like provoked that seizure. And then once you identify what that foreign object is in the brain and have it removed, that person could just return to having a normal life with no seizures at all.
Yeah.
How common? Yes.
These are infections in the brain, like meningitis, encephalitis, can all provoke seizures. Like parasitic infection, like neurocysticercosis, was one of the common organisms which affects the brain. Now, these seizures are provoked by an infection, but they affect the brain tissue directly. So many times in such patients, although there is a provocation, the medication would probably be prolonged because the brain tissue is affected. So this may be provoked by some external agent, but the brain is affected primarily. So they may give rise to epilepsy in a more number of people rather than the pure provoked seizures, which have disturbances in the body function, but they don't affect the brain directly.
Very, very interesting. Okay. Well, folks, if you have any questions, please don't forget the phone lines are open, 936-2626. I'm happy to take your calls and, explain anything or answer anything. Or if you even have a story. Sometimes people are suffering from this disorder and very few people know that they are. So this is an opportunity to, as we say, normalize the conversation around these types of things. So of course you can find us on cmrtv.com, Facebook, YouTube, and even on Instagram this morning, as well as Bobo 103.1. Good morning to Miss Emma. See you jumping in there on the chat. So good to see you. So we are talking, in case you're just joining us, about seizures, which it is epilepsy, my apologies, Awareness Month. And so around that, we're having a conversation around the different types of epilepsy, as well as seizures. We do have a phone call. Good morning, caller, and welcome to the program. So good to have you.
Good morning.
Good morning.
I have a question for the doctor. I feel a little bit late, but I realize we're on topic of epilepsy, and I was diagnosed with epilepsy like around age 13 or the onset of puberty, basically. And ever since then, I have been on medication, and I've seen like one neurologist, visiting neurologist here, when I was sick and all of that. But a few years ago, I went to my neurologist. I don't think he comes here anymore, but I went to him and he wanted to increase my dosage after realizing that the medication that I was originally on, which was the extended release, I was no longer taking because, short story, I swapped jobs and I went to work for the government, and they gave me the regular release, I guess, not the extended release, and I was taking that in the same dosage quantity as if I was taking the extended release, and nothing ever happened to me. I took that for years. So when he realized that I was taking basically half of the dose I should have been taking, he tried to take me off of the medication because he said that it was so small that it shouldn't be doing anything. So my question is it possible to have taken medication for all these years, not necessarily needing it, but then when I try to come off of it, I react to not having the medication?
I mean, I guess there's a couple questions in there, including, is it possible for someone who has had epilepsy to be cured of it, where it just stops?
Well, go ahead.
No, go ahead. Go ahead with the and complete.
What I was going to say is to my understanding is that so I have juvenile myoclonic epilepsy. That's what I was diagnosed with. So my understanding of that is that it comes at the onset of puberty and then it goes away like in your early adulthood. But if you've been on medication for that long, and I don't necessarily, the medication is quote unquote not doing anything, then I just can't understand why I can't come off of it.
Yeah. Okay.
Okay. So juvenile myoclonic epilepsy, what she described, is kind of a primary epilepsy syndrome in which there is basically a disturbance in the electrical circuits in the brain. So, and it has a genetic component also to it. The thing about it is that it requires medication to control the seizures. Now, they are like partial seizures, like they have, like sudden flinging movements of the arms, but they respond very well to medications. But you require medications on the long term. They are like high tendency to kind of come back when you stop medications. Traditionally, they require a lower dose than the high dose we require for a classical primary generalized seizure. Juvenile myoclonic epilepsy would respond to a lesser dose, but that dose will be required for a long duration. As you stop, it'll come back. That is the characteristic of that seizure syndrome. So you would probably have to take a dose for the seizure, and usually it's for a long duration.
Okay, caller, does that answer your question?
Yeah, that's interesting because the last time I've had a seizure, quote unquote, a seizure, I went unconscious, would have been like 2017. So in my entire life, I probably only went unconscious like 2 times since ever having it. And that's what, over 20 years ago? Yeah. But okay. I guess it's still required.
Yes. All right. Well, yeah, keep on top of it and make sure you keep on top of your, your checkups and so forth. So thank you for the question. Very good question.
Thank you.
All righty. So so sometimes I guess if it's considered a chronic disease, we want to think that maybe it's been reversed or there's some way to come off the medication, but it's a good question to ask Dr. Susan, because even people who are in high blood pressure medication, I didn't know this. I thought, what if you just get that blood pressure under control? But I understand that one of the worst things you can do is stop taking the medication, because then it comes back like with a vengeance. It becomes almost like medication resistant if you're not careful. So very, very interesting to know that about epileptic episodes as well. Right. So phone lines open, folks. If you've got any questions, Dr. Susan is here as the expert, and he can certainly answer them for you. The one that she mentioned when we talked about causes, she said that it's something that happens like kind of in the teen years. Is that a popular?
Yeah. No, this particular subtype of juvenile myoclonic epilepsy, like the term itself is juvenile. It's the onset is when you are in your teens, and it's a specific subtype which the EEG that we do. So you see the electrical waves. It is very sensitive in picking up a specific pattern, which helps us diagnosis of the case and the history. Of course, the patient comes with a very strange history that there'll be sudden flinging movements. They'll be holding a cup and suddenly it seems that involuntarily they're throwing it away. So they'll come that maybe the parents will come, he keeps flinging stuff around, breaking stuff around because they are not in control. And very rarely it progresses to generalized seizure where they lose their consciousness. It may be for many years, all they would have is sudden flinging movement.
Very interesting. All right. So causes, let's go through some of these, Dr. Susan, so that, we have a better idea of what really might trigger an episode.
Yeah. So like we discussed, seizure is caused by an electrical storm or a short circuit. So if you imagine the wiring in the brain as wires, if there's a short circuit and a spark, that's give rise to a seizure. So if the wiring inside the brain is wired abnormally from birth, then they have a tendency to seizure. Those are the genetic causes of the seizures. So if the circuits, brain circuits, are wired in a way, they have a tendency to have a burst intermittently, so they can give rise to seizures. Now, any damage to the brain tissue which causes disruption in these circuits can also give rise to seizure. The most common being an injury to the brain or a trauma after an accident. When you have injury inside the brain, it disturbs the circuits, and this can give rise to seizures. Similarly, in stroke, when you have a clot or a bleeding, they will damage the wiring inside the brain. And in about 5 to 10% of patients with stroke, they'll end up with having seizures. Brain infection like meningitis or encephalitis affect the brain tissue, again disturbing the electrical activity of the normal electrical activity and can give rise to seizures. Tumors, aneurysms, again, are structural abnormalities which kind of disturb and impinge on the circuits. They can give rise to seizures. And in many cases, we do a lot of investigations, but unfortunately, many times we don't come up with the exact cause, but the history of a seizure itself is diagnostic enough.
I was just thinking about a young lady who, her son, I don't know how he did this exactly, but I think he sticked his finger in like the socket or something, and he basically got electrocuted. And then after that, he started to have these episodes. Is that something, again, that he's going to have to deal with lifelong, or is that something that potentially he could, quote unquote, grow out of? Or, when it's caused by a very specific incident, does it tend to be something that can be resolved?
Yeah, provoked seizures, when you have an external event which kind of has a transient, they usually require treatment for like a shorter duration, and we can look at the specific cause and decide a plan to take off medications later on. So yeah, if there is an electrical current giving rise to a seizure, we can of course do repeat investigations and slowly plan to taper off medications in such scenarios.
Okay. All right. Wow. So we've got stroke. So that is also a potential cause. Brain infections, genetic or developmental factors, structural abnormalities. What do we mean when we say structural?
Yeah, it's like tumors and aneurysms. When you have a tumor inside the brain or an aneurysm, it is like a structure which impinges on the brain parenchyma, and that can give rise to seizures.
Okay. So interesting. Wow. Okay. And then unknown causes. So again, this is sometimes you just don't know what it is that's causing it.
So it's difficult, a diagnostic problem in many cases, because the EEG, which is designed to see the electrical activity, has a sensitivity about 30%. So many times you don't get the specific pattern of abnormality, and the MRI shows a normal brain parenchyma. So you have to go by the clinical picture and treat the patients accordingly.
So with this young boy, he did some brain scans. I don't know what the result was, but it says that the parent says that nothing was done and they didn't treat him for it. And so occasionally he still has, seizures, and he just lies down. Should everyone who's having epilepsy be on medication?
Yeah, if you're having a tendency to have recurrent seizures, you should be on medication, because these can be life-threatening. Because if it happens, it's a scenario or a situation which is not conducive, like somewhere in the water, you have a seizure, you can drown pretty easily. Even in shallow water, you're driving, you have a seizure, you can lose control of the vehicles and cause accident. If you're walking near a fire or a construction, you can fall and cause serious harm to yourself. So if you have a diagnosis of an epilepsy, you should be very careful about your medications.
Okay. Someone is asking if you can talk a little bit more about juvenile myoclonic epilepsy. and whether or not this is something that can be passed on genetically, because they're worried about their children potentially being impacted by this as they become teenagers. Is it something that tends to run in families because they're not aware of family history? So they're sort of wondering how that works.
Yeah, juvenile myoclonic epilepsy does run in families, but the pattern in which the inheritance happens is a little kind of a very, okay, so these are the special. Yeah, we can go for extensive genetic testing to see what is the pattern of inheritance or what is the genes affected. And basis of that, we can decide about the inheritance patterns. If there is a risk, it's not always necessary that it passes on to the other siblings or the children, but you do need to get a genetic analysis of the done to see how many of, like, how much is the affection and what is the risk of it passing on. Like I said, it is more of in most of the cases is a benign condition. Like, it is affecting you, but it can be very well controlled with medications.
So you can actually test then for the gene.
Yeah, we can.
Oh, well, that's good. Okay. Very good to know. All right. So some of the symptoms then, and I think this is important for people who maybe have never witnessed someone with epilepsy or witnessed someone have a seizure to be able to recognize what it is that they're seeing, and then also hopefully what they can do when this sort of thing happens. So it's uncontrollable. You can go through just a list here of what some of the symptoms are that manifest themselves, but uncontrollable jerking and shaking or fits. A tingling feeling in the arms or legs. Does this tend to present itself before the loss of like consciousness or the uncontrollable jerking? Are there sort of signs that, okay, you're going to have an episode?
Yeah. So seizures can be preceded by what we refer to as an aura, where you have a specific group of symptoms depending on which area of brain is getting affected. Sometimes you have an abnormal smell like of a burning tire. Okay, that's very specific. Sometimes you could have flashing lights in front of your eyes before you pass out. Now, tingling sensation in arms and legs, these are mostly affected with focal seizures, where you do not lose your awareness, but they can also be associated with general seizure, where they begin with the tingling and gradually progress and affect to the other limb. Now, when a generalized seizure happens, it basically has three phases. The first phase is what we refer as a tonic phase, when your body becomes stiff. As a result, most of the patients kind of fall down. And the next one is the clonic phase, where you have sudden jerky movements all over. And then is the post-ictal phase, when everything stops and the patient is kind of stunned or confused for about 5-7 minutes. This is all a part of the seizure. So you understand, when you have a sudden electrical storm in the brain, even when it is stopped, your brain is kind of a numb for 5-7 minutes. You're confused. You're not aware what's going on. And then you slowly start coming back. And of course, the focal epilepsies can have certain twitch, it's manifest as a twitching movement in the face or twitching movement in the arm.
Yeah. And one of the, it's quite interesting because I've, we all watch these little like videos on different social media channels. And I've seen these videos of babies, and someone thought, oh, look, this baby's doing this. This is so cute. And somebody says, no, that's actually, the baby's actually having a seizure. But the parents didn't recognize that, kind of like that stiffening, like they thought the baby was just like scared or something, but they didn't realize that the stiffening was actually symptomatic of the child having a very, very specific type of seizure in babies. And so infantile spasms, is something that, although rare, that you should be aware of what it is and what it looks like, because a lot of people can just mistake it, because of course young babies especially have a lot of involuntary movements anyway. So sometimes we're like, oh, they're just being babies, but it's something that people should really look out for, because it can present itself very, very differently in infants.
Yeah, pediatric epilepsy syndromes are very difficult to recognize because the patient can't really give you a history of what's going on. Abnormal movements may be mistaken for the baby kind of normally playing around. So it's quite a challenging field. Like we have a different subspecialty totally dedicated towards pediatric epilepsy. It's something which is taken over by specialists who kind of deal with this subset because it's so difficult to diagnose and treat.
Mm-hmm. So interesting. All right. So they usually last anywhere from a few seconds to a few minutes. And some persons may lose consciousness and not remember what happened. But if you suffer from it, is every episode the same, or can you have a variation from episode to episode in terms of how it manifests itself and whether you lose consciousness or not?
So a person suffering from a seizure subtype would probably have the same kind of a seizure again and again. Of course, if you're are on medication and it's a kind of a breakthrough seizures, then the pattern might be a little less violent to kind of a smaller seizure. But mostly, if you are having a particular type of seizure, it will stick to the same kind of symptoms again and again. And most of the seizures last less than 5 minutes. So that's the thing to remember when a patient is having seizures, to remain calm, that this most likely would pass off within 5 minutes. So what we kind of teach the family members or the caregivers, the 3 C's to remain calm, because the first thing is don't run around like causing or increasing the panic. Remain calm.
Yes.
Try to give comfort to the patient. Second C is comfort, because such patients have a tendency to fall down and injure themselves. So put a pillow, put a jacket, whatever you have under the head, so they don't like bang the head and injure themselves. If they're losing the consciousness, turn them to the side and allow them to breathe freely. Make sure there's nothing around the face so they can breathe in freely. And do not try to pin down or hold the patient, because when they're having jerky movements, there's a tendency to kind of control the jerky movements by holding onto the hands. You might cause the shoulder to pop out, because these movements are involuntary. They can be really powerful movements. When you try to hold the hands, you see patients' shoulders pop out. So just let it kind of have its course. It usually, like I said, self-terminates in about 4 or 5 minutes. And the third is call for help. Now, when do you call for help? If it is a first-time seizure, then definitely call for help, because we don't know what's going on and what causing the seizure. If it's a known case of seizure episode, maybe you can just wait for it to pass out. If the seizure is lasting more than 5 minutes, if the seizure has stopped, but the patient is not coming back to regaining his conscious, still remains confused, then definitely call. Any breathing difficulty, definitely call. So just follow the 3 C's of being calm, give comfort to the patient, and call if you think that the patient is not recovering.
All right, very good. So we have some commenters here who are adding to the conversation. Thank you so much. Miss Barbara says, I have a friend that has seizures from time to time. My concern for her and her grandchildren is that she's often on the road with one or more of the kids who are too young to assist her when she's in distress. My point is that the family doesn't seem to have enough information about the danger of her having the children in her care at all. How concerned should you be? I mean, I don't know how frequent these seizures are, but it sounds like they might be. But how concerned should you be if that person is a primary caregiver for children or even an elderly person, and they themselves could become incapacitated?
So if the proper workup has been done and a diagnosis has been reached, and the patient has been started on adequate medications, usually they respond well. And once we know that the patient's seizures are controlled with medications, and they can have a normal life, so we should not be worried about that. When the diagnosis shows a certain background condition in which there is a very high risk of seizure recurrence, then it's a different issue. We educate the family accordingly. But the whole point of treating patients is to make sure that they have a normal life.
Mm-hmm.
So due diligence, due care is of course required, but in most cases, once the diagnosis and the treatment has set in, they can have a normal life. We kind of ask them to observe for a first month or two when they're on medications, because we many times when we start a dosage of a medication, it may not be sufficient. We might have to increase the dosage. Rarely that happens. But once you are on a medication and you're taking them regularly for a month or two, most likely the medicine is kind of enough for you. It's just like a blood pressure medication. You are on the medicine, you are on a proper dosage, your blood pressure will be under control if you take the necessary precautions. So
Mm-hmm.
yes, care and our diagnosis and knowledge of your disease is very important. But once the treatment is proper, you can continue with a normal life in most cases.
Yeah. But it doesn't, I'm getting the sense from Barbara that maybe it isn't quite under control for this person. And so that is where, driving kids up and down and, being in charge of grandchildren might be a real concern. So perhaps her family can reach out, to make sure that you're getting the correct treatments for her. So interesting. All right. Well, Marshall, morning, Damaris. Marshall says, I have a friend who suffers from seizures, and he says that he can tell when he's about to have one or have an episode. He hears something like a sound ringing, and then he stiffens up and it comes on for like a minute or two. Then he goes to sleep once it's over. It's really sad to see.
He should come in for evaluation, because most of the seizures, especially if they are like for short duration, they should respond very well to medications.
Mm-hmm.
You could walk up the case, see what exactly is causing it, and probably decide on a medication for this. For partial seizures, many times patients do not come in because they kind of manage it by kind of taking off for a few minutes or a few hours. But that's not the way you should be going about it, because sometimes they can be generalized. Like I said, it depends on the situation where you are. Where if you are inside of water and the seizure happens, it can lead to devastating complications.
Mm-hmm. All right. Cece says that my child would normally be playing and just lays flat on the ground and stiffs out like seizures. Yes, it's less than 5 minutes. And I had to talk to him for him to try and bring himself out of it. So, I mean, does someone bring themselves out of it, or is that just the natural length of time that it's going to last for?
Like I said, most of the seizures last less than between 3 to 5 minutes. But with the child, it's very difficult. They should consult a doctor, kind of take a look at the series of events that are happening, and maybe plan investigations just to rule out if it is something which the child is doing normally or there is something else in the background. Definitely a consult with a pediatrician, and then planning out further investigations would be recommended.
Right. And there's no situation where a child should be having seizures and they're not on medication.
If diagnosed with proper seizures, they should be on medications, because you see, every time a seizure happens, it kind of damages or stunts your brain. And when you are in the growing ages, continuous events would hamper your cognitive abilities later on in life.
Wow.
In children, the presentation can be very subtle. So one of the more rare seizures episodes is what we refer to as absent seizures. Now, here what happens, the patient doesn't have any physical manifestations. They just zone out. You're talking with the child, suddenly the child has gone into a distance, like daydreaming. Many times it's reported in school with a decrease in the school performance. The child was doing really well, and suddenly one semester he starts performing badly. And the teacher would probably complain when you go to meet the teacher that your child just dreams in the day. He's kind of not listening to me, and he's this probably can be a symptom of absent seizures. So there can be very varied manifestations or presentations. So anything like abnormal should get evaluated by the doctor.
Another person is inquiring whether seizures can occur as a result of an anxiety disorder.
Anxiety disorders can precipitate a person having seizure to a background because lack of sleep is the more common precipitating event. So if you are not sleeping for a night or two, then you can definitely precipitate seizures. So basically, that is how it works. If you're anxious and not getting sleep, that's how a seizure can happen. But anxiety directly causing seizures is very rare, and it, of course, difficult so many times to differentiate if the anxious person movements are due to just because of stress or they are due to seizure.
Mm-hmm. All right. Very good. Wow. So incredibly interesting. Thank you. CC says, thank you. I will follow up with the HSA because he did an MRI and a scan and nothing else was done. So it's important for your son, sounds like, to get in a proper treatment plan. Paula says you cannot talk someone out of a seizure. So it's important to know, yes, medically, how these things work. Is there any harm in talking to someone during a seizure?
Yeah.
Yeah, like is there anything harmful if you're talking to them? I know that you said you kind of want to, not try to
No,
hold them or anything.
when a patient is having a seizure, he cannot respond to you.
Yeah.
So you may not ask, but if it is due to anxiety, sometimes clinically that's how differentiate. Patient won't be having a symptom, but they're responding to your commands during those episodes.
Mm-hmm.
That means it's more likely be due to anxiety because some of the symptoms may be similar to seizures. But if they are coherent and are responding to you when they're having the events, it's more likely to be an anxiety. So you can't so patient with a true seizure would not respond to your commands in a coherent way.
Okay, so you're saying that it potentially mimics an anxiety attack.
Yeah, an anxiety attack sometimes can mimic a seizure, but that's
Uh-huh.
where the clinical evaluation comes in. So when you have a person having a symptom, but responds to you, you can talk with them and they respond. Like when you can ask your name, where do you? They can keep answering this question, but still have those moments. Most likely that they're having an anxiety attack.
Okay. Wow, super interesting. All right. So some of the treatment options. Let's talk then about what the treatment options are.
Yeah, well, the first line are the anti-seizure medications. We have a huge range of medications which can be tailored to the type of seizures, the personality, the age groups, the different interactions they have with medications. So once a seizure is diagnosed, we mostly start off with a medication tailored to that person's needs. We have to identify that the causes where a seizures can recur. Now, when you're having a seizure, missing even a single dose of medication can precipitate seizure. So you have to be very regular with the medication. You can't miss even a single dose. Second is lack of sleep. That's a very important trigger for seizures. So if you're having seizures, then make sure that you sleep 5 to 6 hours at least. People end up with having seizures after a late night party where they kind of it carries on for late and they end up having a seizure. Flashing lights can trigger seizures. If you have a seizure tendency, then like a TV or a disco, playing games, when there's sudden bursts of light, they can trigger seizures. So make sure that you avoid flashing lights.
Mm-hmm. And movies too, because some movies and even video games and stuff can have that effect on people. So you have to be very careful because they can be a trigger. All right. Paula says, as a parent of an epileptic for over 2 decades, I'm grateful for this line of conversation. It's shocking the ignorance and lack of information about epilepsy. Thank you for this. You're most welcome. And I wonder, Paula, as a parent, what have you found as probably the most challenging, other than probably as you say, the misinformation, lack of information, and the ignorance? How does that present itself in terms of challenges? Like if you're out and about, and your child has an episode, or how have people responded in schools? There's just so many complications around lack of information and ignorance. And that's why these segments are really, really important. So thank you so much, Shamari, and the entire team of physicians and support staff at Health City Cayman Islands. So why all in matters? So again, being all in, which is a theme for this year's Epileptic Awareness Month, is that you have to learn how to recognize a seizure. So it's possible that you could see a stranger having one or a family member. And the more you know and the more you recognize it for what it is, then, the more you can respond appropriately. Knowing again what to do if someone is having one, speaking openly to remove the stigma, and supporting people with epilepsy at work, at schools, and in daily life, and in encouraging timely diagnosis and proper treatment. So if you know of someone who's had 1 or 2 episodes of a seizure, maybe just check in with them to see if they have gotten a proper diagnosis, if they're on medication. Like, I just checked in with someone who said, nope, nothing has been done yet for her child. So now she's going to chase up and follow it up. It's not something that you just want to leave alone if they're having them on a regular basis, especially with children. As you say, it's something that can obviously impact their brain as it continues to develop. Ms. Dawn has a question or comment rather. She says, good morning. My son is 5 years old and he has seizures. We can spot them when they're starting, and if caught early and play him out / make sounds, and it would ease. So is that, I don't know, Dawn, if he's on medication or anything else, but what does she mean when she says, well, I guess we have to ask her, but when she says play him out or / make sounds, I'm not quite sure what that means, but can you, again, Paula said you can't talk someone out of a seizure. Can you play them out of it? Can you make sounds to snap them out? Like, how does that work?
Difficult, like it actually doesn't happen. Maybe the seizure would have terminated naturally during that period. But like I said, a true seizure doesn't respond to any kind of a distractive maneuvers. It's only anxiety, which mimics what we refer to as psychogenic seizures. That's a different group, because yes, people with psychiatric diseases many times manifest with symptoms which mimic seizures, which we refer to as non-epileptic seizures, which we see in a lot of patients. The main differentiating point there is, in a true seizure, you cannot distract or talk during the seizures, or you can abort it by any kind of a activity. It usually self-aborts, so maybe it's a very short seizure, maybe lasting a minute. By the time you do something, it anecdotally you think that you're altering the course, but it actually doesn't happen that way.
All right. So, Ms. Dawn, maybe just, remain silent because it doesn't work. So I know that sometimes we think because of coincidence and timing, that something is working because of our timing. Like we say, well, when I do it, he seems to come out of it. Well, he would have come out of it anyway, is basically what the doctor is saying. When it comes to the stigma that is attached, this person says, I lost a job because of a seizure, was not officially diagnosed with epilepsy, but with generalized anxiety disorder because the company was concerned about liability. Wow. This is really quite shocking. Ms. Dawn, thank you so much, says he is on medication, kind of distract him, and it's helped him relax. Okay.
Yeah, definitely, if that helps, it always is encouraged. But taking adequate medical precautions and consulting the doctor is to go hand in hand with that.
And Ms. Paula says it's timing, and we want so bad to help, but it's not us. And I'm sure, especially from the perspective of a parent, it must be very, very difficult to watch a child go through this and not be able to do more. So I'm sure that those are some added challenges there. Well, this has been an extremely educational conversation. Do you do something from the onset of the very first seizure, doctor, or do you wait and see if there's like a second one? Or the second someone has one, you say, no, we need to go and see a physician?
So if it is a provoked seizure, like we have a clearly external factor leading to the seizure, we can wait. Like if you have a low sodium, if you have a fever giving rise to seizure, we wait. But if we see something structurally affecting the brain, uh, then we know that the chances of recurrence are high. So after thorough investigations, we see the EEG pattern, the electroencephalogram, which is a test we see to see the brain waves. They have different patterns. So if certain patterns are alarming, they have a high chance of recurrence. So depending on the clinical presentation, the background of different illnesses which cause the seizure, and the investigation, we have to take a decision case by case. Now, your profession also comes into play a lot. If you are a pilot, if you drive a bus, if you are going for scuba, then it's a whole different scenario, different factors. We have to be extra careful in these conditions because you are responsible not only for yourself, but a whole lot of people who depend on you. So it is a difficult decision. It requires a lot of multiple investigations and clinical scenarios before we take a call that we can wait or do we need to start your medication in your case scenario.
And one of the things I know, especially with younger children, is they always say that if a child has a fever, that you want to try to get that fever under control because one of the, sort of long-term effects can be, even brain damage or a seizure and so on. So fevers in children, that's one of the reasons why it's considered very, very serious. You don't just sit down and say, they'll eventually come out of a fever. You want to try to give them something or take them to the hospital to try to bring that fever down.
Yeah, children do have a tendency to have seizures during febrile episodes. They are classified as febrile seizures. So if you have a child who has had a seizure during a fever, usually the doctor would always advise you to make sure that you give the paracetamol and make sure that the temperature doesn't become high, because it's only when the temperature crosses a threshold that you can have seizures. Usually these febrile seizures, in most cases, kind of go off as the child ages, so you don't actively need any treatment in most of the cases.
Okay. All right, Ms. Dawn, thank you so much for sharing your experiences, as you say. Paula says, yes, people are prejudiced against, and it's really sad. So thank you so much, moms, for sharing these experiences. All right. Well, Dr. Susan, it's always nice to have you on the program. And especially today, we learned, I think, quite a bit about epileptic seizures for Epileptic Seizure Awareness Month. Shamari, thank you for bringing all of these amazing experts and conversations to the forefront right here on Medical Rundown Tuesdays.
Oh, definitely. And thank you, as always, for having us, Sandy. And just before we leave, just to mention that it's Lung Cancer Awareness Month as well, as we would have discussed before. So you can get your lung cancer scan for US $50. That's the special. You book before November 30th, and the appointment has to be taken before December 31st. For those 50 years older, history of smoking, current smoker that quit within the last 15 years. And I think Dr. Archida said that if you smoke more than or equivalent of a pack a day or more, then that would necessitate that you fit the category of heavy smoker and probably should come in. So it's a low-dose CT scan. You'd get it at East End. If normal, a nurse will contact you. If there needs to be a follow-up, then we'll set an appointment with Dr. Archida to have a conversation and to see if there's any further types of diagnosis that would need to actually occur. And it's also November, so you can get your men's health check for US $649 as well. And you need to book in the month of November for that. So we have two specials going on, knowing that, once again, there are so many disease profiles and highlights throughout the month of November, but definitely thought it was important to also get Dr. Susan on to speak about seizures, seeing as this is the month that we try and highlight and educate as well in regards to that disease profile.
Mm-hmm. Excellent. Fantastic. All right, folks. So the month isn't quite over yet. We've got a couple days left. So please take advantage of that lung screening. And again, Ms. Barbara's and her husband are waiting on their results today. So absolutely amazing. Good morning, Miss Lucille, joining us from the UK. Paula says, thank you, Shamari. Lady D, blessed Tuesday to you. Barbara says, thank God she doesn't drive, but I was convinced that her condition has not been properly diagnosed, as she'll be sitting and talking and then suddenly she's drooling and her eyes are rolling, going back to her friend around, and then she's back to normal. She has often fallen down. Oh my gosh, no. And yet her doctor has not recommended to help her, which leaves her caring for helpless grandchildren. So Ms. Barbara, maybe you could step in and help with that situation a little bit more. Take her by Health City, make them just double check the medications that she's on, if she's on anything. And then, it doesn't sound like it's really being managed quite properly. So I would say maybe get a second opinion. And you don't necessarily want someone who has uncontrolled epilepsy around children, because what if you were cooking over a stove, or, there are lots of instances, even if you're not driving, that things could happen that would be quite dangerous.
Yeah. The situation can really make it really, really life-threatening.
Yeah. All right, folks. So the more you know, the more you grow. So that's what these educational segments are all about. Thank you again to Dr. Susant. Thank you to Shamari. I really appreciate you guys coming on the program today.
Thank you. Thank you.
All right, fantastic. Have a beautiful Tuesday, rest of the day. And wow, that is quite educational. And someone who I'm speaking to here this morning says that they would have an episode and they were not completely unconscious. Their body would go limp after the convulsions. So people thought that they were unconscious, and they could hear them saying very unkind things about them during these episodes. And they said it was, I was like, wow, that's kind of sad. And I said, yes, it was, but it showed me who my friends were. Thankfully, they haven't had one in over 10 years. And they also addressed the anxiety disorder. So that is pretty crazy that people would actually be standing over you, saying unkind things as you're having such an episode. Oh my gosh. So be conscious, folks, of the fact that they're not necessarily unconscious, and you want to be helpful and not harmful, especially when it comes to their mental health for something that they can't even control. Oh my. All right, so we're gonna go into a couple open mic topics this morning. 936-2626 is the telephone number. Someone is reporting a JA of the day. If you don't know what a JA of the day is, honey child, you've been missing out on all the good stuff. Here in CMR, it is called Jackass of the Day for a reason. Because some of y'all be special. You be extra special. So if you drive a Toyota SUV, I can't tell the type, license plate number 207303, you were caught on camera this morning. My goodness. I wonder how you could possibly explain this one, but let me show you guys the video evidence of the poor driving. Somebody says, please make this person jackhole of the day. It's actually jackass of the day. But anyway, look at how they were driving on the shoulder. And I'll tell you what the eyewitness said. Here's the video evidence. So they had the music, nice music going there, but here's this person. And yep, caught in the act. And this person says, this is past the Cayman Bay underpass, where there are clearly two lanes. This guy rode the do not drive lane all the way, causing havoc, and he came within 2 inches from hitting my vehicle. The dude, be considerate and use the proper lane. Everyone wants to get home. So that was yesterday evening at about 6:24 p.m. So I'm sorry, but you'll get nominated, and looks like you might have well deserved it. That's not what that lane is for. So we're going to have to post you up. And the Popo, this is the thing about some of y'all JAs of the day, is the Popo actually pays attention now. So when they see you, sometimes they're going to reach out. And if it's a ticketable offense and they have evidence such as the video, they will issue you a ticket. So you guys need to behave on the roadways. You know, they're trying to do more in terms of road safety, because we've just got such horrible driving, you know, yeah. Such horrible driving on the roadway. So just a couple quick announcements, if I may. There has been a extension on the, let me just show you this. There has been an extension on the NICE program. The registration has been extended until today at 4 p.m. So please, we posted it on our social media channels for all of you to see. But if you could, if you're interested in the NICE program for the Christmas holiday cleanup, by all means, go ahead and register. The registration link is there and available for you. So get registered. If you need a little bit of extra Christmas money, this is a fantastic way to do that. All right. So I think we posted it yesterday afternoon about the extension. So yeah, go ahead. Get on it. So we had a couple shows yesterday. I'm trying to see if I can just find it and I'll put it in the comment section. So yeah, extended at 4 p.m. today, being the 25th. And here is the registration link. I'm going to just put it down in the chat if you guys need it. You can also scan the QR code. So let me just show you the QR code on the screen. You can scan this as well if you'd like to get registered. There you go. So scan that QR code. And we ask, please, this is government money, government work. If you're going to do it, please, no drinking on the job, as we've seen previously, no smoking on the job, as in smoking marijuana, sitting down, smoking pot all day. And, you know, actually clean up. That's what you're being paid to do. So we'd like for you, it's the National Community Enhancement Project. And they do it now at least once or twice a year. And it's done through the Ministry of Planning, Lands, Agriculture, Housing, Infrastructure. And it's a way for people who otherwise do not have employment to be able to, you know, get some funds. They're starting this round of beautification and cleanup projects on December the 1st through the 12th. So just in time for the holiday season. So once they get started, you'll see them around the island, you know, in their little security reflective jackets, little vests. And yeah, we like to see y'all working. And this time of year it's nice because it's not too hot out there. So, all right. Someone said that they were hoping that this program could be all year round. I mean, I don't know. The government has the budget. This is not cheap. So I'm not really sure what the budget is for this and if it's viable to have an all year round budget. But I think, you know, once or twice a year is certainly not a bad idea. But it is very, very interesting, I must say, that it is very, very interesting that the some of these people year after year do it, and then the rest of the year they don't work. So I'm just like, why are you not working? I don't think, I'll be honest with you, I don't think that if it was a full-time situation that you're going to find that many people signing up for it as you might think. Because these are people who want seasonal jobs, because apparently they only need money sometimes. I'm not quite sure how that works, because bills are always due every month. I saw a statistic the other day that was kind of interesting. It said something like 70%, this is in the US, but I'm sure it's came out as well. 70% of our paycheck, as soon as we get it, is gone within that first week. You paid monthly, it's gone within that first week. And then the rest of the month, you're skimping by, and that remaining 30%. I'm hoping that that's a good sign that people pay their bills right away and don't wait. But, you know, that's why they have all these loan to payday businesses, because everybody's broke after the first week. So on yesterday's CMR TV, we had some excellent shows. I think we had about 4 or 5 shows on just yesterday alone. We had Mind Matters, which was Dr. Carlos Garcia and Supna Doshi. They had a very interesting conversation about people struggling with imposter syndrome, which is the nagging belief that you're not good enough. Did you guys catch this? This was such an amazing and interesting conversation. I hope that you guys had an opportunity to tune in and to listen. If you missed it, you can check out our YouTube and social media channels. So YouTube and Facebook, and cmrtv.com will have the individual pages for the content creators as well. So you can go back and listen to episodes. So that is our Mind Matters show, where we look into all things, mental health and wellness. And yeah, that was a really, really interesting episode. So this podcast, I'm going to just see if I can bring it up for you to listen to just a little snippet, just a little teaser, so that you can, go back and listen. Hold on one second here and let me see, honey chill. Right. So here's a little snippet from that show. Again,
Welcome to the podcast, the Human Experience Podcast, where we explore the depths of spirituality and our own personal journeys and experiences. I'm Dr. Carlos Garcia.
And I'm Supna Doshi. In this space, we'll reflect on the wisdom of some of the most profound spiritual teachers, from Eckhart Tolle to Ram Dass, Wayne Dyer, Michael Singer. Together, we'll dive into their teachings and share our own insights that have guided us on our own paths of self-discovery.
Each episode will feature inspiring clips from these masters, weaving them into our own reflections and conversations on how spirituality has enriched our daily lives, deepened our understanding of ourselves, and led us to a more meaningful experience.
So, take a deep breath, open your heart, and join us on this journey of exploration. Welcome to the podcast, the Human Experience Podcast. So, take a deep breath, open your heart, and join us on this journey of exploration. Welcome to the podcast, the Human Experience Podcast.
Yesterday, I'm sitting at the table with just like the stellar of the stellar, right? Like Navy pilots, this woman who's a psychologist and swam the English Channel, these people that have like MBAs from like Harvard, right? Just like amazing, like people that have done amazing stuff. But when you talk to them, they're both humble about it, but also don't see themselves accurately. And so I'm always intrigued by why it is so hard for us to see ourselves accurately. And by that, I mean like the good in ourselves, right? Like how we're easily able to see the good in others, but it feels so hard to see it within ourselves. As a psychologist, I know that there are certain environmental factors that sort of lead to that. And other factors that I think sort of contribute as well. But sometimes I wonder if it's like something almost like intentional or that we're supposed to have or carry around, or do we ever move past this aspect of us that, just kind of pushes for more, right? Pushes to grow, to learn, to expand. The more I study this and the more I try to understand it, I think that the more complex it gets.
Well, I always like to use a metaphor of an orange. I love the orange. Perhaps living in Florida is why, but an orange is a simple metaphor. You take this orange and you squeeze it as hard as you can squeeze it. And you ask yourself, what will come out? And what comes out when you squeeze an orange? Orange juice. Never, no matter how many times you squeeze it, will apple juice come out. There's no mistakes. You'll never get grapefruit juice out of this thing, ever. The only thing you'll ever get out of it is orange juice. And the next question is why? Why, when you squeeze an orange as hard as you can squeeze it, does orange juice come out? And I asked that question up in Toronto one time. There's a little girl sitting right in the front row. She said, "That's dumb." She said, that's what's inside. It has to come out. I said, well, that's the answer. You are really smart. And she smiled. She thought that was great. But that's the truth. The reason that orange juice comes out when you squeeze it is because that's what's inside. Now you extend the metaphor and someone squeezes you. That is, someone says something about you that you don't like. Someone behaves towards you in a way that you find offensive. Somebody does something or says something to you that you feel hurt by. And out of you comes anger, hatred, bitterness, tension, fear, anxiety, stress. And immediately you say, the reason that comes out of me is because of how he said it, or the way that she said that, or because they did that. But the truth is, the reality is that what comes out is what's inside. And if you don't like what's inside, you can change it.
Yeah, that's so interesting. I think that hits for me on a lot of different levels, both personally and also with.
So listen, go and watch this episode. I can tell you guys that it is one of many really amazing, segments that we've got yesterday. Now, today's lineup, let me just have a quick look. Let me tell you guys what is on today. Give me 1 second. So our team every single morning is going to be doing a, let me see. Going to be doing a, we're going to be doing a sort of a daily visual so that you can see exactly what shows are up. So let me just grab this one for today. And some people, we're waiting on some individuals. Things are still in production with them. So for example, Miss Julie Hunter has a show that normally would be on Tuesdays, but hers is still in production. And her kitchen talk with Miss Julie would have been this evening. So her team is not quite ready. So we have obviously my show, Sabrina's show, and we have the AI Wave, which is going to be another really, really interesting show coming on at 7 o'clock. And that's with Tamsin DC. And Tamsin does a lot of interviews with movers and shakers in the world of AI. And the focus for her first episode, which airs tonight, is going to be AI in education. And she's getting some really big heavy hitters when it comes to, AI. I mean, it's amazing exactly, what's happening out there. So yeah, so good stuff. Let me just see. So every day we'll put the schedule up. We'll post that on social media. Thank you, Sophia. She says she loves the pink blouse this morning. I was going for pink vibe, and the closet's color coordinated. So I had one with little sparkles on it, and I said, nope, I'm going to save that for closer to Christmas because that's more of a sparkly vibe. So yeah, thank you. I appreciate it. Dawn says, absolutely, it can only be who you are on the inside. It's so interesting what triggers, like what we allow to trigger us. And I think that absolutely we've all been there where someone pisses us off and you're like, and then you kind of, sometimes you have to get to the point where something almost becomes comical to you. So I had someone last night, let me just remember the conversation. They were sending me some messages and, I was saying this yesterday when we were talking about Miss Jamaica and the fact that I heard from very reliable sources that she was, after her fall, she's still in the ICU there in Thailand, that she was having a really difficult time. Now, I know that the official word yesterday, the official narrative started to change, like, oh no, she's fine. And, she's doing great. And she's coming around. And the truth of the matter is she is having a difficult time, but sometimes people try to cover it up. Like they don't want people to know that they're struggling. And that's unfortunate because I think we all struggle, and we certainly can all struggle, at different levels. There are different reasons why we struggle. So, it's okay to admit that you're not okay. It's okay to say that, man, I'm really pissed off because maybe I could have been in the top 30 had I made it to the final competition, or even the top 5. Who knows what her dreams were in terms of that pageant, right? And it's understandable that she could be going through some things now on an emotional and mental level, having physical injuries. Everyone has a different perspective of who they are as a person. Some of us are like, we're all about like, oh, we're beautiful, we're smart, and anything that challenges that. So you get sick. That's a challenge to your perception of yourself and your reality. We don't always deal with these types of things as best as we could. There's some people who have an accident, now they're disfigured. And there are people who will go through life being okay with that. Like they will find a way to survive and to pull through. And other people, because their physical appearance and their beauty was such a part of who they are in this world, that they can't go on, and they're like, oh, life has ended for me and I can't go on like this. So everyone, I guess, prioritizes things a little bit differently. So someone sent me this, I don't have the video clip, but someone just sent me a screenshot talking about some comments. And then I'm going to show you, this is Mario Rankin. And I don't even know why Mario continues to talk about me. Like there's something just a little bit weird about this, where you begin to feel like, the obsession is real, boy. Like, what is this all about? I don't even know what he's talking about. So I can't really put it in context. But apparently he was having some comments to say about me because is Cameron here this morning? Maybe Cameron can fill us in. But Cameron said, we make Mall Road. How can we fear something we create? So I don't know what that was like contextually, what this is about, but I do know that Mario is constantly saying that people only come on this program, or they only listen and watch Mall Road because they're afraid. I mean, this is the most ridiculous thing I've ever heard, right? The times that we have the most people watching, last week or the week before, remember we had over 1,500 people watching when we were doing that whole Cayman Fiesta thing. You think over 1,500 people watching a live stream and plus radio and Instagram, they're listening because they're afraid of Mall Road? No, it's because we're talking about something that is interesting to the population and that they want to hear. And I got to be honest with you, most of you seem to be most interested in the sauce. So it's on those days that the numbers really tend to escalate above, the 300, 400, 500 kind of usual live viewers, right? People don't listen and support this platform because they're afraid of anything. And the irony of it is the only reason you would have to be afraid of anything is if you're up to no good. And that goes from politicians straight down to the guy who's driving on the shoulder of the road, who, will now be posted, and hopefully the police will reach out to him. If you're doing the right thing in life, you don't have anything to be afraid of. We don't just go around. I don't even know what it means, but somehow in Mario's head, it gets him brownie points. I'm not sure. Maybe I should make him some brownies. Maybe he needs a little bit of brownie love. I mean, Johan, what do you think? I know you don't want to share your brownies with anybody, and I haven't really made any. I haven't given Johan any in a while. But I'm just thinking, like, maybe he needs a good hug. I don't know what's wrong with Mario. Like, I can't quite put my finger on it. But at the end of the day, Mario, honestly, on a regular day, you don't cross my mind. I don't think about you. I don't talk about you. So why you find it necessary to obsess, especially on this point about, people are afraid of Mall Road, they're scared. I'm just like, this is a perfect time for me to play this. Hold on now, honey, chill. Where's my little button? What a paint. What a paint. What really is the paint that you're trying to make? I don't know. So Cameron, there you go. You can tell him you guys have nothing to fear. Sophia says Mario has a crush on you. I'm beginning to wonder, because when you're younger, they tell you this all the time. Like the little kid who's always pulling on your pigtails, always messing with you, like Mike in high school. The reason Mike kept messing with me because he liked me and I wasn't really returning the favor. There is a psychologists would tell you, yes, a lot of people who are constantly obsessed with talking about you and picking on you, whatever. It's because low key they got a crush on you. And I wouldn't doubt it. He's not really my cup of tea. But I wouldn't doubt that. You know, who might not find a little bit of brown chocolate nice and pretty Caribbean flavor? But he can't handle this any child because I got a mind of my own, and we all know that Mario can't handle strong women. I think that's really his problem, is he doesn't like to see women who are strong in their own, whatever it is that they're doing. And that's why it's not just me. I shouldn't feel too special. He picks on Jackie from DART. He picks on, what's her name from government there? Oh my goodness. I think she's now working in the DG's office. Help me out with her name, somebody. Tall, brunette. She was chief officer of health at one point. Oh my Lord. What's her name again? I always forget her name. It'll come to me. Oh Lord. What is her name? Jennifer Ahern. So he tends to pick on Jennifer Ahern and stuff a lot. And it's just that, you know, if you are a strong, independent woman who has things going on, apparently, he feels a way about that. And that's kind of sad for him, because that means that something is not fulfilling him. Like there's something missing in his life. And so I don't know what to say. Except please get help. I mean, there's help out there for you. So I don't know. Invite him for brownies. Well, he can't come over, but I'll be happy to take him brownies. I promise I won't put anything in them. Nothing but love and nuts. Hopefully he's not allergic to nuts. We can do nut free. And yeah, he could just enjoy some brownies. Lady D says, just a suggestion, maybe the program should be done every 6 months. I think the NICE program, I think it is more or less about every 6 months, because you do like Christmas time, and then they'll do like during the summer and stuff as well. Listening cause stuff is productive. Tartarian says, true. I have always said it. Leaders can't make people hate. Hate was already in them. Some people take the truth for hate. Oh. Okay. Marshall says they should be afraid if they up to no good. I mean, and I hope most of the people are not up to no good. You know, we get reports about people all the time, but I don't think that that's the majority of people. That's always the few, the minority that makes everybody else look bad. So Sophia says, you hit the nail on the head. He needs some motherly love. And it's interesting that you say that, because I do wonder, really and truly, why the focus a lot of times is on women. Like, why is that the focus, right? Because he goes hard at some men, but it's mostly women that he seems to have a problem with. And that is a little bit worrying. I must tell you, if I was his mama, I would maybe have a conversation with him. Like, where did we go wrong in our relationship? Because when you find men hating and beating on women and disrespecting women the way some of these jokers out here doing, there's a deep-seated issue with the first relationship they've ever had with a woman, which would have been their own mother. And so there's something to be said for that. But you know what? I'm going to just pray for you, Mario. You know, I'm not even really addressing you anymore. I've said all that I've had to say. And you know what is so funny? Can I tell you guys a little bit about him? He's actually a coward. He's one of the most cowardly people I have ever met. For someone that has as much moat as Caymanians would say, he got enough moat, you know, as someone that has enough moat like him and can get up and talk. Anytime I have picked up the phone and even messaged Mario, he is such a coward. The man don't want to respond. Cowardice. I mean, he is the biggest coward that I actually know. And you guys have seen here when I've called him, you know, starts like, yeah, just coward. I challenge him like, I can't back up what you say, dude. I'm like, really? You're like a little boy trying to come in the ring with big people. And when I put on my little gloves, and I'm like, all right, I'm ready to have a little boxing match with you, then you start stumbling over your words. And I'm just like, what? What's going on here? That's because you can't back up. It's all about the fluff. It's all about the appearance. Someone says, I disagree with Tartarian about leaders can't make people hate. Brainwashing is real, which is why cults are successful and many other similar situations of influence. And I do agree with that too. I think influential people can turn other people into little monster followers. You know what I mean? So I agree with you there. But yes, it's just really, really sad sometimes what we witness. And I think some of it is he believes that he's running a competition with me. And so maybe the way that you run competition with someone is you constantly want to talk about them and be hating on them. No, Bobo. How you, if this was a competition, which I don't think that it is, but if it was, you just level up your own game. You focus more on yourself than any third person. And then, let the chips fall where they may. You don't hyper focus on anybody else. You got to watch the man in the mirror. And so I don't really know. It's just kind of weird. But for those of you who enjoy sending me stuff, don't. Like it's gotten to the point now where it really is a waste of time. And you guys would be shocked to know, speaking of him being a coward, that every single time I see this boy in public, you would swear, this is why I'm like, is he bipolar? Does he have memory loss? Because he actually goes out of his way to speak to me. Like I've seen him on a plane where he was behind me and initially I didn't even see him. And then he goes out of his way to say hi and, oh, how are you doing? And how's the I'm like, huh? I'm just like, what the hell? Like, it's just really, really weird. Like I'm weirded out by it. I'm not going to lie. I'm just like, what is this all about? Because when I don't like somebody, you can tell, because I'm not messing with them. I ain't got nothing to say to him when I see him in public. I'll even cross the street, Bobo. Like that's the kind of vibe I'm about. But this dude if he sees you at the coffee shop, I'm like, what? This is just weird. Like I don't understand I can't deal with this kind of a relationship. It's just too bizarre for me. Miss Lucille says, Sandy, when people talk about people, it's something special about you. Well, except for politicians and people who we're like, paying to do a job. Of course, we got to talk about them and their slackness or civil servants, but there's no legitimate reason for the obsession that Mario has with me. Like it really doesn't make any sense. Sophia says he can't stand a strong woman. And I really think that has a lot to do with it. There's something off with the whole woman thing with him. Like he likes women to be under him and where he feels like he can talk down on them and so forth. And I'm sorry, but my Aunt Lottie did not raise me that way. No one is going to disrespect me. I bring my A game and I bring everything to the table. And it's because part of it is because I want to achieve things on a personal level. But the second part of it is, you can't just talk the talk. You got to be willing to walk the walk, right? So it's easy for podcasters and so-called bloggers and whatever titles they're going by these days to get on a platform and just talk about whatever. Oh, they've got all these solutions. They've got this. And then it's like, okay, it's great to hear you say these things, but how have you even demonstrated that you have a true understanding of the issues that are facing us as a country, individually, all these things? And you have to start with the man in the mirror. So let me be very, very clear. I have heard from you guys that, Mario has come from a very chaotic, abusive household and, all sorts of stuff down Windsor Park. And it was probably in some respects no different than the environment that I was coming from. The difference is I was actually removed from that environment and I saw something else. I saw that there's a possibility to be something else. Like you don't have to stay in chaos, right? You don't have to adopt that as your way of life. And so I do make a conscious effort every single day to try to be a better person. And for me, that's really, really important on all levels. Sometimes I lose my ish, and yes, I'm going to curse you out. We're going to keep it moving. But even having said that, there is a need to elevate yourself, elevate your product, elevate yourself, educate yourself, have higher level discussions. And so even when I sit down, there are days that I don't want to do my schoolwork. Can I just tell you, yesterday I was doing some homework. I was actually catching up. Gigi asked me yesterday when I picked her up from school, Mom, what did you do today? She's asking me this a lot lately. I don't think she understands what I do because I don't go to a traditional 9-to-5 job. She's like, did you have more meetings? Because I'm always like, oh, I had a meeting today. And I was like, no, I was actually doing some homework. She said, you were? Well, how was it? I was like, well, it was kind of hard, Gigi, because I wasn't really that motivated to do it. But this is my primary text. One of my texts is called Essential Law for Journalists. McNay's Essential Law. Can you guys see that? Oh. The light in here. Let me see if I turn this one off. It's this backlight that is too much. I gotta fix my lights. There, because now you get a better look. Yeah. So this is the primary text. As you can see, the text is like hardly opened. I really haven't been reading. I've got an exam coming up in February, so I guess I better start reading. But most of this I kind of know already, so it'll be a little bit of a review. But anyway, I was working on my homework assignment. Yesterday, I submitted 2 assignments. And one was to do with the publication laws as it relates to like anonymity of defendants, especially if they're children and that sort of stuff. So I was knee deep in it. So I said, yeah, Gigi, I did some homework yesterday. And this program that I'm doing, half the days I have no motivation to do it, I must tell you. But I'm doing it just because it's not something that I need in order to do what I do successfully. CMR is already a success by all measures, right? So it's not that I need this piece of paper. This is a personal goal. So when everybody says, well, she's not a journalist, I'm going to whip out this certificate when I'm done, this diploma from the London School of Journalism and say, there you go, Bobo, come again. Say that to me one more time, right? So it's more about silencing all these ridiculous wannabe critics than anything else. Because I can tell you probably about 75% of this I already know from my general knowledge, as well as I already have a law degree. So, but yeah, I'm still going to do it. I just got to stay motivated and stay on track. But this is what you do. You just up your own game, just work on yourself, and I kind of think that sometimes there's certain people, like if they had something else to focus on, like maybe Mario should go get a degree. Put your mouth how does it go again? Put your something where your mouth is. What's the something that you're putting? Put your actions where your mouth is. I can't remember the exact saying right now. I don't want to say the wrong body part. Put your foot where your mouth is? No, that doesn't sound right, but whatever. Go out there and accomplish something, right? It's not put your money where your mouth is. Well, he doesn't have any money, so that wouldn't be an appropriate saying for him. But just do something more with your life. And then you'd want to focus less on me. Like if you were a success in business, if you were a success in your personal life, if you were a success as a parent, like all these other things, I think low key, you would really stop obsessing about other people, right? And like I said, a lot of it though is like, it's almost to get points from you guys, the audience. So he knows that there's a certain sector, I guess, of Keyman that's like always upset with me about something. Who knows, whatever. And so he feeds into that because he thinks that somehow that doesn't pay his bills, though, I can tell you that, right? And so he does like kind of feel like, I guess that's going to give him some kind of reward. But dude, the average person who's listening to you, if they know that every time you see him at the coffee shop or you pass him in the street, you go out of your way to say hi, that's kind of low key being a fraudster. Like, I don't even know what that is, right? You're scared. You're scared to have, because I can challenge you any day of the week that you want to take me on and have a conversation about anything, Mario. I will come on your platform. You can come on mine. We can do it. And I can bet you will never win a sensible debate with me, because I'm coming with facts and figures and numbers and information, because I know what I'm talking about. This isn't just a constant emotive conversation where I'm gibbering jabbering at the mouth about nothing. There's sometimes when you got to put that aside and you just have to come with like a different level of intellect. So y'all need to go listen to the imposter syndrome thing, because, some of you are imposters for real. Like, you're pretending to be something that you're not. And the people who bought into it during the whole COVID anti-vaxxer thing, because he really played y'all for that. I don't even think the dude was really an anti-vaxxer, but he knew that he could get a certain portion. I remember when Izzy went on his platform and did an interview with him. She's like, she never thought that she would see the day where she would be on the same platform with Mario, sharing any kind of, cohesiveness with him. And I kind of chuckled, because I said to myself, if she really knew that Mario was not even that committed to the whole, anti-vaxxer thing, he just jumped on that bandwagon because it was easy to do so. And there was a lot of you who were supportive of it. Some of you lost your lives. I saw poor Phaedra yesterday, was her birthday or something, so sad. A lot of you just jumped on it. It was, maybe you were connected to the belief system, I don't know. But I can tell you that Mario really wasn't. But yet he was milking it for every single click and like and whatever. So you guys were all over his platform with it. And I was like, okay, let's see how that's going to work out for you. And now most of you are like, ugh, back to not being able to listen to him. Now that's over. It's just interesting. I don't know. It's just so weird. I don't even know what to say. Let's talk about media, because we're already kind of talking about it here. I know that you guys probably saw the article yesterday that Caymanian Times has been purchased by Stingray Media. Now, there was someone in the comment section on social media. I suggested that they go read the story, because they didn't seem to people comment and you can tell that they haven't read the story, because they're like, oh, well, I hope the DART organization hasn't bought Caymanian Times. You know what I really want to say right now? I want to say that the DART organization probably has more sense than that. I mean, they probably were regretting buying Cayman Compass, much less Caymanian Times. But anyway, no, the DART organization didn't buy it. It was a DMS organization, which is now Stingray Media. So what can I say except, they're going to try a thing with, what's his name again? Oh, Lord. Oh, sorry. Some names just really escape me. What's his name from Caymanian Times? Ralph Lewis, right? So yes, it's been sold. And so this person was like, oh, and then they start obsessing about DART. I'm like, DART didn't buy it. Why don't you try reading the article before you jump into like, oh, I hope this whole conversation. I'm like, read the article. If you read the article, your point becomes like a non-point. Who owns, this is Positive Change. I don't know who the hell Positive Change is, but they put in caps, who owns Stingray Media? If y'all have been paying attention to anything, you would know that DMS Broadcasting is now Stingray Media. Obviously, they're expanding. They picked up a newspaper. They've got EK, and they've got their radio stations. And so this person's obsession just seems to be that, well, at least it's an indigenous Caymanian. The DART organization has said, however you want to take this, that if they didn't purchase the Compass, nobody would have purchased it. And then it would have been completely defunct. And then you guys would have been sitting here complaining about that. Like, oh my God, we don't remember when, just like Cayman 27. Remember when we used to have Cayman 27? Remember when we used to have the Compass? So, take it for what it's worth. But the DART organization said, we saved you a newspaper. And it's good to have competition. And it's good to have different types of media, right? So the Compass is still there, obviously. And yeah, so, now Stingray Media is getting in the print and news media, which I think I am going to, we're all watching this space very, very carefully. When was the last time any of you ever read Caymanian Times? They say they're going to expand it. They're going to have an investigative reporting segment. Okay. Ralph is still in charge of it. I really can't say much more than that. We're on a Stingray Media station right now. And so I will reserve any additional comments for when I have my own radio station next year. I am just like, okay, everybody has a business model and people will have to make purchases and make decisions and movements. And it's not for me to tell the Stingray Media team whether they've made a good, sensible movement or not. Time will tell, without a doubt. And, you know, I think they have a lot of work to do if they hope to be any sort of a competition, especially for the Compass. Caymanian Times is like way down the totem pole. Let's talk about Radio Cayman for a hot minute. Someone sent me a video last week, and I'm trying to find the actual link from that day because I want to go listen to it fully. And I'm afraid that I haven't been able to do so. Was it this person that sent it to me? I'm trying to find the video now. But anyway, they sent a query during Parliament from Kenneth Bryan about Radio Cayman. And when I listened to it, I was actually a little bit confused. I must tell you that, you know, I didn't quite understand it. Let me just see if I can find the video here. So it was something to the effect of, why doesn't, because of course, you know, Radio Cayman falls under the Premier Cabinet Office, right? And the budget last year, we know that when Julianne O'Connor Connolly took over, she made it very, very clear that Radio Cayman was her favorite station. And so therefore, she was going to pump a lot of money into Radio Cayman in hopes that that would somehow allow it to be more successful. And I mean, you know, that is kind of nonsensical. It hasn't really proven to be the case. Who sent me the video with Kenneth last week? I thought that was you, but I don't see the video now. Was that the 17th or the 18th? Somewhere around there. But anyway, this person sent this video clip of Kenneth asking this question in Parliament, where basically he said that, here's the video. Hold on. Let me just play it for you guys. He was asking a question about what is the government going to do about Radio Cayman's social media presence. And I'm confused because I'm like, what does he mean by that? Radio Cayman already has a social media presence. They're on Facebook. I guess they're on Instagram. I mean, I follow them on Facebook, but I don't follow them anywhere else. And so I'm not even sure that I understood what a pint. Like, I'm not really sure I understand where he was going with this. You know, some people simply cannot get that what the real solution is, in my humble opinion, okay, for the success or not of Radio Cayman, is that the government has to understand the limitations. Not that they've got a multi-million-dollar budget. They allow Radio Cayman to competitively, you know, engage with getting ads, engage with customers. So they're like a hybrid station. They're a not-for-profit, but yet they make money. And government still pumps a couple $1 million into Radio Cayman. So it is very, very bizarre. But what they need to do, if you wanted my humble opinion, is they need to actually amalgamate Radio Cayman along with GIS into one entity so that Government Information Services has their own radio station. They need to give up one of the stations. I don't know why they have two radio stations. So keep Radio Cayman, get rid of Breeze, which is all this additional programming and people sitting there programming a station that nobody listens to. When you ask people, well, what radio stations do you listen to? Nowhere does Breeze ever come up in the conversation. So I think that there has to be an amalgamation of Government Information Services. None of these so-called brilliant MPs have ever really had this conversation and talked about it. So I'm trying to find this clip. I'm trying to find what day the premiere was on. But here's what Mr. Bryan asked him.
Thank you, Mr. Chairman.
It's a bit low.
Can the minister say when
He says, "Thank you, Mr. Chairman.
broadcast efforts for Radio Cayman will be
When-
added to those many social media platforms?"
So when will the broadcast efforts for Radio Cayman be added to those social media platforms? Hold on. Let me just get the transcript here, because it's like a clip of, I think they were just recording it from the phone. So it's a little bit difficult to hear what he says. I actually think we have the transcripts now. Let me see if this is it. Yeah. So he says at, let me see here. Radio Cayman. Let me just see. So, let me see if we get, let me just see. I'm trying to get his question, because it's an odd question and I'm not quite sure that I'm understanding what he means by it. But anyway, he put the question to the premier. And of course, these guys are trying to answer these questions as best they can, I suppose. And so the premier answered that essentially, this was a 7-hour recording with this person only sent me, let's see here now. Okay. Right. So he says, social media. I'm trying to find the exact question. Where's this question? Particularly. Okay. So somebody says, let me listen to this. Can you guys hear that? Yeah. Okay. I don't think you can. Okay, so let me just see how I can get you guys to hear this, because I have the audio transcript of it. But I'm trying to see how is the best way for you to actually, I think I'd have to do I'd have to probably download this. This is like a 5. They should allow, what they should do is they should allow me to like clip out a segment instead of having to download the whole audio file. Oh my God. All right. So it's 5 hours and 53 minutes in. Let me see if I can just find the YouTube bit. This is probably the easiest way to do it. So this is from the 17th, I think. Let's just go to CIGTV. And the 17th would have been Finance Committee. The 17th, the 19th, the 18th. Here we go. Yes. All right. So let me just pull this tab out, and then we can find the exact segment together, because this little clip is a little bit hard to to hear. So let's pull that out, and then I'm going to do a screen share with you guys, and then yes. Okay. So this is Finance Committee. I'm looking for 5 hours and 53 seconds in. So 5 hours, 5 hours.
Relationship between
5 hours and 50. 5 hours and 53 seconds. So let's fast forward it a little bit more. 51, 52.
Opposite. We want to ensure
50. Okay,
Mr.
so let's
Bryan?
go here.
Thank you, Mr.
This is
Chairman.
as close as we're going to get. Okay.
The Radio Cayman component doesn't
So we have the Kenneth Bryan. All right, so let's listen to this together.
come under this provision. I think it comes under CBO 721, right? Okay, I'll wait to my question there. Thank you.
Any further questions on CBO 17? No further questions.
Mr. Chairman, there is one more. Sorry, I apologize. Thank you. Can the Premier just give us any updates in respect to developments in the communication space? I am very happy that there's a government that understands that media is important and communication with the public is important, and the rightful investment and innovation is being done. So I just want to actually give them an opportunity to talk about that, because if in fact you see new programs or structures or funding necessary, it's because communication is key to democracy and representation. So anything new that we can expect, particularly as social media and media develops so quickly.
Honorable Premier.
So again, I'm confused by what he says. You know, I don't quite understand it. Media is important. Yes, we all know. So I actually want to give an opportunity to. I don't understand.
I was surprised that the vote would pass if the member from Georgetown Central did not ask something about comms, because I know he's passionate about it.
Okay.
Although there aren't net new posts, what we're trying to encourage is a better pooling of resources and the use of professional fees by the Department of Comms. So the budget, although like any other department, you'd want it to be larger. But what we found is that since there are embedded communicators within each ministry, and I can understand the minister wanting to keep their own comms person close, we still need to enhance the pooling of the information so that we can maximize the messages that go out towards government, and also make sure that we're using as many platforms as possible, because there are so many now. A few years ago, it might have just been Facebook and Instagram, but now it's Snapchat and all the rest of it. So, and some people only consume that news that way. Some people don't even pick up the paper anymore. So it is a rapidly growing area. And I think we're going to have to move with the technological times and ensure that there's as I say, a better centralization, not necessarily the people smashed in one department, but centrally coordinated.
Mr. Bryan, continuing.
Thank you, Mr. Chairman. I'm so happy to hear that. I think the Premier and his team fully understands that, so they have my full support and they know that. There is one, I can't remember, what's the Chinese platform called again? TikTok. We had a bit of an issue with that from a concern based on the host.
Anyway, I mean, he goes on, but I'm confused. So are we saying that government, I mean, I don't even engage with Snapchat myself, but are we saying that the idea here is for government and Radio Cayman to be on TikTok, on Snapchat, and all this sort of thing? I mean, I understand the need to meet the people where they are, and I preach that all the time. But I do think that there has to be some sort of an understanding on why you are already on some of these social media platforms, very popular ones, I might say, and people are still not paying attention. So let's go to Facebook. I mean, for Cayman, Facebook and Instagram are two leading social media platforms that we are definitely on, right? Yes, TikTok has a particular following. But you know, statistically speaking, it's Instagram, it's Facebook first, because a lot of the older people who are not on Instagram continue to be on oh, look at all these recipes they're always putting up, trying to get me hungry, continue to be on Facebook. So if we, for example, go to Radio Cayman right now, okay, Radio Cayman Choice. Like I said, nobody listens to Breeze. And I think it's unfortunate that the government is actually holding on to that Breeze frequency and that Breeze license, because somebody else could have that frequency doing something much more meaningful with it, right? So here they are. I mean, they had a show this morning. Let's just go to the numbers. Past live views. So the Buzz this morning with Kathy, 2 hours later, has 131 views. Talk Today with Charles Glidden from yesterday, 21 hours later, had 175 views. Look like he had beauty pageants on there, beauty queens. That's interesting. OC, who is their headliner, is still only bringing in 215 views from a day ago. Talk Today, is Charles Glidden, is he doing the Talk Today program full time now? That's his full-time gig, like every day? I thought he was guest hosting, so that's why I'm asking that question. But it looks like he might be there every day. 143. OC went up to 291 on Friday. So I think Friday is normally a pretty big day for him because that's when he has the opposition on. Charles Glidden had a big day, 311 views. The Buzz with Kathy, 188 views from a week ago, 5 days ago. So by all measures, right? These numbers, and sometimes they go up a little bit. Here's the minister on the 14th, 232 views. And, you know, discount a few of them as like staff members probably sitting there watching or whatever. Here's Michael, Honorable Michael Miles. He got 311 views. Who's this guy sitting next to him? Who is that?
It's a world of
somebody look like they've been working out. Let me see who that is.
The MASH unit.
Trying to figure out who that is. Hold on.
So therefore,
nope. Let me fast forward it a little bit.
Training. And
who was that in the bluish shirt?
From them.
Auntie's like, who's sitting next to Michael Miles looking all buff?
So the things of what we're doing right now gives the
Mr. Wesley, have you been in the gym?
Or the Department of Work?
You look like you've been
to improve our customers.
up in some weights or something. Okay then, Bobo. I'd
want
take a
you
closer
to
look.
go back.
I was like, who's this person with some arm muscles?
But also
Yes,
in 2024, we
mess with
gained
you.
12,000
So
companies.
yeah, I mean, I just
12,000
gave him another
companies
view by
chose
clicking on
this
it. There you
jurisdiction
go.
or people
Good
in our
stuff.
country decided,
But you know, 301 views for when a government minister's on is, how can I say, piss poor. That would be the right choice of words, right? Who's this guy? Money Sense. 158 views there. Sports Extra, 145 views. So, you know, this was a good day. OC had a good day at 445 views. So it's not, they don't normally have very many people tuned in. Okay, is that Shamari? Shamari is there, 198 views that day 2 weeks ago. That looks like Shamari. So yeah, I mean, it is what it is. Okay. Now, by comparison, we were going to do a money show. Interesting. Who's this one? I'm looking at these people going, who are their guests? This day looked like they had members of maybe that's the Filipino community. 427. They brought in some views that day. 417 with 2 government ministers on October 27th. So they're obviously streaming here. They also stream on YouTube. So we could go to YouTube and we could actually see the numbers on YouTube as well. So let's have a look. Maybe you're arguing with me and you're saying, Sandy, most of their views are on YouTube. So I said, maybe you're right. They do seem, they have video shorts that trend a little bit better, but let's go to live. And 83 views, 126 views, 317 from Oric Connor show yesterday, 155. So more or less the Buzz, 190. So they're getting comparable numbers. Sports actually only got 90 views. So they're getting comparable numbers here, right? A couple hundred here and there. Some days it fluctuates up a little bit. 408, 477. Yeah, so it goes up a little bit. And you can then go and check CIGTV and see what their numbers are for not this stuff, but the regular daily coverage, which they do a lot of content. 252 views. That was the premier's message. The weather, that's when we were watching that storm. That got a couple thousand views. So weather stuff does well when we have something going on. Meet the Minister, Honorable Isaac Rankin. That was 2 months ago. That got 300 views. So yeah, the views are not really there. But imagine if you pulled Radio Cayman into CIGTV and it all fell under communications. I think you would probably stop splitting and duplicating your efforts where it would actually make a little bit more sense, right? Now, listen, not for nothing, but I can go and look at what pops up. Speaking of news, Blake now shares the Caymanian Times covered their own acquisition, which is great. And he shared their story. But let us have a look, just to be fair, at CMR, because we can't talk about other people and then not go look at our own views to see how we are doing, right? So Sabrina's show from yesterday, 5.5 thousand views. Mind Matters. This is the episode 1 of this show, just aired 21 hours ago, 3.9 thousand views. Go there, Dr. Carlos. Yesterday's show for the Cold Hard Truth, 14.3 thousand views. And this is on the higher end, I'll admit, because yesterday you guys are really interested in the sauce. This is my video. I don't really look at video shorts because they tend to always have higher numbers. So I don't, for comparative reasons, I only looking at the shows, right? So show to show to show to show. Sabrina had 6.5 thousand from Friday. Marla's show from 3 days ago, Marla Dukran, her inaugural show with us premiered on Friday. She's got over 6,000 views already. We have Sabrina's show on Thursday, 5.9 thousand. My show last week with the Muslim community, that was Thursday's show, 10.3 thousand. So, you're looking at 5 point something thousand, 6,000, 3,000, 10,000. This one, last week, Tuesday, we had 11.2 thousand. No, I think that would have been, you know what happened? The show cut off, so it was split. So the first part of it got 6.5 thousand, and then the second part got 11.2 thousand. Yeah. So, Sabrina here, 7.4. The Cayman Fiesta show got over 16, almost 17,000 views. So there's a big difference here in the number of people that will sit down and watch a show, even for a couple seconds, versus what Radio Cayman is doing. So why are we continuing? Oh, it's Miss Debbie's birthday today? Or is this just, Miss Debbie's birthday, happy birthday. We got to post up a little birthday thing for her. Happy birthday, Miss Debbie. Make sure I wish her a happy birthday. So yeah, the bottom line is this, right? The reason why this matters is because we already have a comms budget, probably in the millions of dollars. And then we turn around and we subsidize Radio Cayman, who makes money of their own, but they still have to be subsidized to the tune of several $1 million again. Is there not a better way when it comes to government comms to actually spend that money and amalgamate those two entities so that you have government communications that includes Radio Cayman, drop Breeze, because does Breeze even have a social media presence? I think they just play music over there, right? So first of all, the first thing of interest about Breeze is that they don't even have Breeze set up as a professional page. I'm friends with them, but they should be a page that you like or follow, not a personal page where you've friended them. Okay? And I don't know what Breeze FM does, because I don't see very many posts on here at all. I haven't been drinking enough water today. Look at me with this full glass. Let me drink. What does Breeze do? Give out birthday greetings from September, and that's it. This is all wrong. If this is a proper government station, and I'm assuming this is the government station. Yeah, the Breeze 105.3. I didn't even know what their frequency was. So I just read that. This needs to be a proper page. This should not be a personal page. And as you can see, it's set up as a personal page. So I don't even know who's in charge of the, I don't know who's in charge of this page even, but this is completely done wrong. And this falls under the Premier's office, which includes Samuel Rose as the chief officer. Is he not aware that this is even set up as a personal page? I guess they don't live stream or do anything really on here. So they just have a couple posts here and there. This is from 2019. That's old. 2023. So they don't really actively post anything of value. This was a DEA schedule that they tagged, I guess, from back in 2018. So nothing's going on here. 2014. Oh, look at my little friend Joel. Oh, wishing him well. Got to check in on him, see how he's been. So yeah, I'm a bit confused. This is when Sabrina was over there back in 2014 with the business buzz. This is a long 2014. That's over 10 years ago. So they don't actively post anything on this page. I'm going to say it once again. What a point. What is the point of that station even? I don't think I've ever listened to Breeze. I'll be honest with you. I believe that they play music, but government, instead of talking about, with all due respect, Kenneth Bryan, instead of talking about government spending more money and, oh, they need to be on social media, they are in social media and they're still not reaching people. So you need to ask yourself, the real question is why? Why is it that you're on YouTube and Facebook, and between the two, sometimes you're just getting a couple hundred views per episode, per show? That's probably not the true measure of success. I mean, are they on Instagram? Let me check Instagram. I don't even know. I don't really follow like people on Instagram like that. I follow like international news. So I'm going to be honest with you. I have no clue if Radio Cayman. Oh yeah, they're on Instagram. So they have over 4,000 followers. They do post stuff. So they already have an Instagram presence. What more do you want? Okay, so there they are. They're on Instagram. They seem to be doing some shorts, getting 9 little likes there, 29 likes, 8 likes. That one got plenty, 89. So they're on there. So I don't know what more he would want. People don't respond. That doesn't mean that you're not, I don't know. Like, I just don't understand what the problem is. From the perspective of they already have a social media presence. So why are we going to be pumping more money into this? Right? They've been there since 2018. I'm just saying. They have a presence. That isn't the problem. Miss Barbara says, I'm grateful for newspapers as I need it for draining my fries. Ease up on the fries. Ease up on the fries. Tartarian says, because Keith had a spat. Who the heck is Keith? Had a spat with OC last week. You missed that drama. He was angry with OC for cutting him off with ads. Once you see that drama, you will see where it's coming from. Keith was rude. Oh, you mean Kenneth, not Keith. Oh, Kenneth and OC had a spat? You see, we don't even know because their drama doesn't even make the news because nobody don't really care. But I didn't. This is the first time hearing anything about that. Heard zero about it. Which means, Tartarian, you one of the few people watching. Carib guy says, I'm calling Marlon right now. No, I'm not on Amazon. What are you calling Marlon for? What about the radio? Well, this is the thing. And this is where they will tell you, well, the truth of the matter is we dominate radio. That's what they say to you. And of course, nobody can tell you that, confirm it one way or the other, that they dominate radio, unless, dun, 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 this is where I'm going to come in now with my evidence, right? Because yes, they're going to say, well, we dominate radio. And you like, well, yeah, well, everybody listen to Radio came out on the radio. And I say, oh, let's look at the Tower Marketing Report. Because that's how we know. Sample size, she does an annual media consumption report. Let me see if I have it handy. Media consumption media. So she being Tower Marketing, Lynn Biles, does an annual media consumption report, and I'm supposed to have a copy here. Now, I can't share a copy with you guys because I get it to use it for stories and research, whatever, but she actually sells these reports. So I have to promise like not to just give it to people and that sort of thing, right? Which is, I respect her request because, we work together. So let me see if I can find it even. Oh Lord, hold on. Where is it? Is that it? Who has it? Tower? Hold on, let me see. I should have this on my computer. I should be able to put my fingertips on this, put my fingers on this. Let me check my Dropbox folder. Hold on one second. Dropbox Tower. Yeah, I tend to Tower marketing report. So I have the one. Where's the one from last year? I have some older ones, but I should have the one from 2024 because she does it like coming up early next year. She'll have the 2025 one, and I want to show it to you. This is why I don't want to go off of. I do not want to go off of memory alone. So I do want to show it to you. Let me see. Okay, let me just see. Media consumption. I don't know what I have it named. Oh gosh, I can't even find it. I know she's definitely sent it to me. Hold on one second. It would have been earlier in the year that I probably got it. Let me just try to have a quick look-see. Documents. Oh boy. Don't you hate when you can't find something? But anyway, I'll be able to put my hands on it. But so yeah, so that what I will say to you is that argument that they're number one, even from that perspective, doesn't hold water, because the evidence from doing surveys, which is the only way that you can tell, because we don't have, in the United States of America, they have like the Nielsen ratings and stuff like that. They like follow who watches what TV shows, what the number one TV shows are. All that they do that through research, right? We don't really have anything like that. So the closest that we have to that is what Tower Marketing does on an annual basis, and their media consumption report covers a wide range of areas, and they ask a number of different questions. In fact, companies can actually pay Tower Marketing to submit a question for people to respond to. And so, where is that report? So it's in here somewhere, Chow. It's my apologies, my eyes or something's gotten in my eye, an eyelash or something. So yeah, so it's here somewhere, but to answer your question, YouTuber, the evidence doesn't support that they're there at all. And the evidence supports continually that they are sliding despite being given more money, even last year, more money. I think the budget has decreased slightly with this current government, not by much. It was like 2.5 million, I heard, or something. Now it's down to 2.1 million, right? We still see that the results have not improved. So yeah, so it still remains very much evidence that they're just giving them that money just to say, we got a national radio station. The other question that I have is, with a national radio station, we have zero training for Caymanians. I mean, I think they said something like there are, I'll have to double check the numbers, but it's about 70% Caymanian staffed, which is good. But they don't even have a training program for all of these years that Radio Cayman has been around. If you would think, like, if you wanted to go into radio, they would have a bona fide radio training program. They don't even have that. That's deplorable. I mean, they are government owned. And so one of the things that you expect, if we're going to pump millions of dollars into a government owned entity, the least that they could do is to be a training ground, to have a broadcasting school or something for Caymanians. That does not even exist. Oh, Lord, I'm trying to find this report. Heaven Bless says, laughing out loud, are you hating on the Caymanians that working for another news outlet? Should they shut down Radio Cayman or only keep CMR? When you miss the pint. When you miss the pint. This, I can assure you, has nothing to do with shutting down Radio Cayman. What I'm saying is we could get more value for money. Y'all are talking about the budget recently and how government must spend more wisely and stop spending frivolously. And, they have to increase fees on all of us because of this, that, and the next thing. Well, there are projects that government has that simply don't make any financial sense. And comms is one of them. They could probably outsource all of their comms and be more effective and do a better job. Yes, I'm in direct competition with them. So, of course, there'll be those of you like Heaven Bless here who automatically will, try to have a problem with that. But if you don't see that there is sense, regardless of what you think, that there is actually logic and sense in what I am saying, then I hate to tell you, but you're missing the forest for the trees. Right? Argue with me, not about your concept of me hating on Caymanians working for other news outlets. We weren't talking about Caymanians working for other news outlets. We were talking about the acquisition of news outlets, right? Ralph Lewis, this is his second time going through an acquisition of sorts. He did it with Cayman Reporter. So if you will do your homework and do your history, which I will now do for you, to simply remind you of the facts, Cayman Reporter was around for a few years. That was Dr. T and his family. And they were actually acquired by Ralph Lewis. Now, what you might not know in terms of the backstory is Ralph Lewis went to work there as like the editor-in-chief or whatever. If you talk to people who used to work at Cayman Reporters, he started to poach their sales, their customers, and poach their client list. So in the end, I think Dr. Tomlinson saw that this was a waste of money, and he had a printing press that he spent all kind of money on that really didn't make any sense. So he basically just gave it to Ralph, and Ralph claims that he bought it on the condition that Ralph and Caymanian Times would continue to rent that little space, that building there, from the Tomlinson family, so that the Tomlinson family would continue to make some money off of Ralph. You see, y'all need to connect the pieces here, because sometimes you say things, Heaven Bless, that makes me see that you're not fully cognizant and aware of what is transpiring even in the world of media. So Caymanian Times has gone through a variety of iterations. In 2021, they started to charge customers to read the paper. Then I think by 2022, they had ditched that idea because nobody was buying it at all. Then they started to make it free. Nobody was still picking it up. Then they turned around and went from publication several times a week down to once a week. And it was free, and still nobody was picking it up. So we're just talking about what's actually happening in the world of media. I mean, I've actually been having this conversation since at least 2018. So this is nothing new. In 2014, CMR, according to the Tower Marketing Report, was crowned as the number one, let me see here now, the number one news source in the Cayman Islands. Now, let me be very, very clear. The Compass recognized that part of the reason that happened is that they unfortunately put up this paywall that never made any sense. Whoever's idea that was, I'm assuming they no longer work for the Compass. It just never made any sense. Oh, I have the survey here, 2025. Phew. I was wondering, I'm like, where the hell is this survey? You know you got something on your computer somewhere and you still can't find it. Okay. Let me see if I can download this. So yeah, so, let me share. I can't, like I said, I can't share the full report with you, but I'll share one or two little segments as it relates to radio. So we were crowned, and again, all of this stuff you can go and have a look at online. We do report on these things. And so here you have, one second. Let me just show you the numbers because yes, you can see for yourself that there we are. We iced out the Compass 62% versus 54%, almost a 10% spread. And then after that, you had Radio Cayman in third place, Loop, which no longer exists. It's going to be interesting to see where, with the new survey that comes out, where the Loop followers dissipate. Loop and Cayman News Service were neck and neck. Then Caymanian Times at 9%. Then the Cayman Islands News Channel at 7%. But you see, this is what I'm saying here. This diagram alone proves one thing. You basically have the Cayman Islands News Services at 7% and Radio Cayman at 24%. They're competing with each other when they're both owned by government. And to me, that's illogical. And it seems that what needs to happen is they need to tag team. They need to team up. Then we have Cayman Bay Times with 1%, others, and then none. 14% of people say that they not read no news. They have no local source of news at all, which is interesting. So there's something flying around here. It was interesting that the year before that, Loop and CNS were neck and neck at 19%. And now Loop had fallen into 11%. You see, when you're running a business, right? Caymanian Times dropped in 2023 significantly. In the previous year, 2023, they were at 17%. By 2024, they dropped down to 9%. Right? So if that's not an indication that Caymanian Times was a failing business, and I'm going to look at the 2025 numbers. Just give me a second here. I have to pull this off screen because I can't show you that report. But let me just have a quick look-see to see what happened in 2025 with Caymanian Times. But there's no doubt that Caymanian Times is failing. So it's not a question of me trying to hate on anybody. We're talking facts here, and facts that can be supported by evidence. So, yes, DMS has big plans for Caymanian Times, but they have purchased a failing business. They've not purchased a successful business. They purchased a failing business that now they're saying, okay, we have the special sauce, we have the formula to be able to turn this business around. And so they're doing that in hopes of being able to turn it around. Sometimes that works and sometimes it does not work. And I can point to lots of examples in business of where it does not work. This is a 110-page document that Tower Marketing, and if you, by the way, or company organization that relies on marketing information, I can tell you that there's a lot of work that the Tower Marketing team puts into this. They look at all sorts of consumables and information about healthcare. For example, the public believes that protecting and promoting Cayman culture and identity, which was 50% of those surveyed, housing for all at 42%, and the economy at 42%, healthcare at 37%, employment at 36% are the priorities of the Cayman Islands government. So this even has helpful information for government to go off of. And then there's a whole section here. You know, oh Lord, there's one of those little gnats or whatever flying around in here. I don't slap him. There's a whole thing here about the top 3 topics by gender. And they do it by gender, age, and even your financial status in life. So it's very interesting how they put this together. So let's get to the media consumption part, because there's preferred channels. So they have a whole thing in CIG communications. And according to this report, CIG communications is failing. That's what they say. Right? Social media, they do a whole thing on social media, traditional media. So the most listened to and preferred radio stations are the same ones. They say Cayman 1 at 18/22%, Hot 104.1 and Star 92.7. Males are more likely to prefer Hot 104.1 and Star 92.7, while females are likely to prefer Praise 87.9. I don't even know who Praise 80. I've never even heard of them, but there you go. There's a notable increase in listenership. So when it came to the talk shows, let me just screen grab this for you. One second. It says here that, again, these were some of the key observations, and then they present you with the details of the report after that. But they said that they actually had an increase in people listening to talk shows, but specifically, as you can see here, there was a notable increase in listenership for Cayman Mall Road talk show, moving from 54% to 68%. Now, it's notable because anytime you see a double-digit increase in the world of statistics, that's when it's then termed as being notable. So we went from 54% to 68%. All right. But they say that there's a general decline in people wanting to listen to shows, going from 72% to 72% to 50%. And it said CMR 50% is still the most preferred talk show, followed by Talk Today at 25% and For the Record at 19%. I don't, trust me, I don't have to sit here and pat myself on the back. None at all. Because if the next closest competitor to us is actually Talk Today, and they're coming in at 25%. So in other words, we have double, basically 100% when you think about it, but double the number of people who preferred this show to them. That's a problem for government, I would think. Right? And then For the Record, which is another, because they have multiple shows, obviously, For the Record, which is another show at 19%. Females are more likely to prefer CMR. 55 plus years tend to prefer Talk Today and For the Record. Not surprised by that. We've always had a... So then they do another column here that says implications. And in the implications column, they have... 2 conclusions. Cayman Mall Road remains the talk show of choice, and Talk Today and For the Record remain viable options for policy messaging to older and local audiences. It's important for government, if they're going to be in this space, in a space that is largely dominated by private sector, that they've got to pay attention to the trends, because that is our money. My money and your money. We all contribute to paying for that. Marshall says breeze is just breezing. Al Ray says they shoot the breeze. They had an under the table spat. Not too many people knew about it, says Marshall. Oh, I'm totally in the dark there. Thank you so much, Strong Wills, about the pink top. I must wear pink more often. YouTuber says ICCI had some classes in broadcasting, if I'm not mistaken. Speaking of that, where is ICCI in all of this? They're not mentioned anywhere here, because do they even have a radio station still? Well, I know that they do, only reason I know it, because I've never heard it on or anything, but the only reason I know it is because DMS, now Stingray Media, recently moved their tower from the Newlands area to Georgetown. And when they did that, they did a little bit of pro bono work. And the pro bono work was done for, what's the name of these people? ICCI. So they actually put ICCI on their tower and got ICCI back up and running. But I don't even know if they have any programming over there. I can't even tell you. I'll have to ask April. I cannot tell you that they even have a proper studio anymore, or if they're just playing stuff in the air. Like, I don't know anything about it. But yeah, they used to. That was like a long time ago. And then I think since Hurricane Ivan, which has been, 20-something years, they haven't done anything with it. So I don't know. So how they do the poll Tartarian is they randomly contact people. So they actually explain in the beginning of the survey how they do the report, who they are, the background and methodology. And I must tell you, the first year that I saw it, I thought, but this is a small sample size. And Lynn Biles actually sent me the data on it, because this is a question. So they said, with this sample size, the margin of error for the total sample of the research is 4.4% at the 95% degree, of confidence. So with their given sample size, 4.4%, 95-degree confidence, right? That's still pretty good numbers. So even if you doubled the sample size, you wouldn't get much of a variance in the actual margin of error or the degree of confidence. And so they actually call people and they contact people on an annual basis, and they mix it up. So it's people who live here, but it's not necessarily Caymanians. So for example, one of the things that they can tell you with media is who listens to the different talk shows and that sort of thing. And quite interestingly enough, CMR has always had a very diverse population from day one. We were split in terms of who listened to us. We have always been split between Caymanians. We have a little bit more female population, but we have always been split between Caymanians, Jamaicans, and then everybody else almost like equally. So in other words, equal number of Jamaicans, equal number of Caymanians, equal number of other expats listen to us. And the other talk shows, not so much so. But I think there was a conclusion that those 35 to 44 years of age were more likely to listen to CMR, to Cayman Mall Road in the past year. And then those earning more than $6,000 a month are less likely to listen to CMR, which is kind of weird. But that's because we're just for the people. I mean, we're for the average person. All those hoity-toity people, I don't know what they're listening to. They're probably not listening to much of anything. But still, we still had the highest number of people, even in that category, listening to us as compared to the others. Right? So our highest number is people making between $3,000 and $6,000 a month. That's like our baseline for the monthly household income. And we still came in, although it was the smallest category for us, we were still the highest number of people in the 6,000 category plus that were actually listening. But they break it down by district. They break it down by nationality. So, we're pretty even across the districts except for the sister islands. And that's because, again, on the sister islands, there's only one real radio station there. That's Radio Cayman. And when we launch next year, our radio station, God's willing, one of the things that I will commit to, and people say financially doesn't make any sense, but I'm going to commit to it anyway, is having a frequency that the Brackers can pick up. So we will be on a tower there. I'm going to set that up because I think that that's important for the sister islands to constantly be part of the conversation. I don't think that they should be left out. Right? But yes, in terms of nationality, we are just about We had like 43 Caymanians, 44 Jamaicans, so one more, 30 other. But again, when it came to other, we had more of a listenership under other than anybody else. For Filipinos, we have double what we listen to, because no Filipino said they listened to Talk Today. No Filipino said they listened to The Record. Some said they listened to the Business Buzz. And we had double the number that said they listened to the Business Buzz, listen to CMR. So these things are important. It's important for us to like know who's listening, look at the trends. You know, they come to certain conclusions on their own. You know, in terms of like who's listening, who's paying attention, and that sort of thing. Anyway, the bottom line is this: the world of media is constantly changing. I am grateful, obviously, for the fact that Tower Marketing puts a lot of effort into this report. They have the split with like male and female, high school educated, college educated, you know, who listens based on that. So for example, for The Record, 63% of his audience is high school educated only. For here on Mall Road, it is 56%. And then interesting, what is this thing that keeps flying around in here? Oh my God. One little thing can be so annoying. For Talk Today, 39% high school and 61% college. And then they do like the income breakdown, the nationality breakdown, and so on. So we'll see when this report comes out in early next year, how those numbers will change and shift again. The world of media is ever changing. That I can tell you. And so we will continue to do our part. You know, we're here adding content, adding all these amazing shows. We hope that you'll support the platform, that you'll find shows that you find interesting. Obviously, if you don't find something interesting, you're not going to listen. That's really what it comes down to. Anthony says, Radio Cayman Talk Today should bring DaCosta to the entity and take off Glidden. He's no better than Sleepy Dwayne. Well, I don't know that DaCosta would be interested in coming on, but I do know that one of the issues with that is that when was this spat? When did this happen? Well, he's no longer minister, but when did this happen? Last week, Friday? Like Friday, just Friday gone, or the week before? Girl and boys, I'm gonna have to go look this up. I didn't know anything about it. So yes, I think, Anthony, that's not going to happen, because if you will recall, what made Mr. DaCosta so interesting is he was fiery. He was a little firecracker. You cannot really be a firecracker in Radio Cayman. It is and this is another reason why I have to tell you, government owned normally means you're limited in a lot of different ways on what you can really say and what you can really do. I'm sure some of them would really love to turn up the heat. And then they're reminded, oh, you're a civil servant, quasi civil servant, even if you're a guest host. This is a government owned radio station. So we can't ruffle any feathers. We can't ask the tough questions. We can't, be critical of government. So like I said, the fact that even Kenneth had a spat with them is like shocking. I better go listen to what that was all about. But DaCosta not gonna put up with that kind of foolishness. He's gonna want to go in there all guns blazing, and they would stop him dead in his tracks. So it's never gonna be more than what it is, because it is a government-owned station. You got to understand the limitations are built in to what you're dealing with. I need to go and see. Tell me what day this happened, honey child. I need to go back. Auntie Julie, tell the Brackers not to listen to CMR. She's strong-willed. Poor her. Well, I don't know what to say about her, but she'll be just fine. Mr. Amelia said they tends to shut you up. And Anthony says, well, that's why the station needs someone that can be objective and can compromise. Well, like I said, I think the difficulty is with it being a government station. It's just near impossible. I don't know, Anthony, honey child. But anyway, we will continue to monitor the space. And we will continue to obviously, pay attention to what's happening, keep you guys updated. It's important that you keep informed. Oh, somebody just sent me. Oh, thank you, honey chill. Somebody said, here you go, mamacita. Here's that show. Yes, sir. Okay. Well, we gotta go watch it. 1 hour and 59 minutes in. Yeah, boy, I love when y'all give me timestamps because then I don't have to be bored to death watching the whole show. I'm just saying. Okay, I am going to. Now I got something go. I'm gonna go do this. Hold on. In fact, I'm gonna use one of my little tools to just clip that, generate captions. Honey chill. Okay. Thank you for the link. I will certainly go have a look. I didn't know what happened to him and OC. How the two of them gonna be arguing with each other? Oh my God. Yes, sir. What a mess. All right, I will go have a look. Good morning, Sandra. I have 8 glucose meter kits that came with the meter needles and test strips that I'd like to give away possibly in your show. Is that okay with you? Can you please let me know and we can arrange for them to be delivered to you or for you to collect at the nearest point? Okay. I'm not the good person to give them to, from the sense that people getting them from me probably not gonna be that easy. But what I was thinking we could probably do is we could arrange for Miss Romelia and her seniors to get them. So can we arrange for the seniors at K-Mankind Action Committee to get them this week? Yeah, because a lot of them, you know, they struggle with those things. So yes. Okay. All right. Thank you for the donation, though. That's very, very thoughtful of you. Yes. Marshall says, ask and it shall be given, just like that. I know, right? Miss Anita says, yes, Woody's show and K-Man Radio back in the day was very interesting. Loved his style. Woody was not on K-Man Radio. Woody was on Rooster 101.1. Does Rooster still exist? Or have they been rebranded or something? So I don't think Woody was ever in Radio K-Man. Not in a million years. But I'm gonna reach out to him. I think he's been busy. We message once in a while. He's been busy. Let me reach out to him and say hello and see if he wants to go work for Radio K-Man. I'll let y'all know. All right, Miss Amelia, I will give them your number so they can liaise delivery with you for those test kits, okay? Okay, don't forget, today, tune in. Sabrina Speaks at 5, the AI Wave at 7. That's going to be a fantastic show. I think somebody was asking me what kind of heavy hitters does she have. Hold on. Let me tell you. She has... let me see here. She has, let me give you some of the people that are coming on her show. So this episode today is New York-based programmer, author, editor, and tech industry expert, John Biggs, talking about being bigly. He's going to be talking about the transformative power of AI, especially when it comes to AI education and so on. That's episode. No, sorry, that's the wrong episode. Today's episode is John Thomas Foxworthy, who is the founder of industry expert John Thomas Foxworthy explored the evolution of AI over the past 20 years. Then she has coming up with episode 2 next week, Dr. Scott David from Grand Harbor Medical as he explores the revolutionary impact of AI in wellness. Then we have episode 3 is a part 2 to that. And then we have Teresa Gostello, who's a CEO of RoomRight, revolutionizing the hospitality industry by monetizing unused room inventory and integrating AI to enhance efficiency and customer experience. So that one. And then after that, we've got a New York-based programmer who is John Big. So I understand that these are heavy hitters. I'm no expert in AI, but I understand that those are heavy hitters there. So I see you. Almost got you. I'm going to go bring my little zapper in. I'm going to slap you. So Rooster is now a chicken, says Marshall. Send on the AC show information. Send on the AC show information. Oh, the one about Kenneth? Oh, child. I'm going to go and listen to it here right now. Give me a few minutes. I'm going to clip it and put that up so y'all can enjoy a little afternoon sus before the evening show. All right, beautiful people. Thank you so much for tuning in. As always, you are the reason, as Cameron rightfully said, why CMR is number 1. There's no doubt about it. Do not forget the NICE program registration has been extended until today at 4 p.m. My apologies. I'm about to give you the wrong time. You'd be like, I applied at 4:25 because of that, Sandy, you know. Let me see here now. Oops. Give me 1 second. There was another announcement that I wanted to make. Hold on. Yes. And also the DVL, the Department of, man, this little gnat drive me crazy. You know, the Department of Licensing and Driver's Licensing, they're going to be doing online services only between the 26th to the 28th. You can do renewals and so forth. Because they are going to be closed to the public for those types of things. So I will, in fact, I'm going to do them a solid, and I'm going to go use one of my AI tools right now and do a little media short for DVDL. How about that? Take that. That's how we do it around here. All of my AI assistants I'm paying for. Y'all have a beautiful day. See you mañana. Hump Day Wednesday. Toodaloo. Be good.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.